I'm very honored to be here this morning with all of you. I'm a registered clinical counselor practicing in Vancouver. I connected with the lovely and wonderful Dr. Susan Swim during my master's at City U through a professor who's also a friend and longtime colleague of Dr. Susan Swim, Chris Kinman. He introduced me to the work of Dr. Swim, and Now I See a Person Institute. So I think that was like 6 or 7 years ago now. Did a couple visits to California, and I've been, very, very grateful to continue to be connected. And I always find these conferences very invigorating, enlightening. Definitely, um, helps me to kind of keep going in some of like the challenging days or challenging conversations. And kind of like staying rooted in, I think, ethics and a foundation of coming into this work and having like a positive vision, I guess, for the future and hope about where we can kind of go as a field. So very honored and happy to be here. And maybe I'll pass it over to Margaret.
Mhm. Hi, everyone. Thanks, Megan. Yeah, my name is Margaret, and I started working with Now I See a Person when I was doing my master's program in marriage and family therapy over at Loma Linda University, which is in Southern California. And I was there basically at the beginning. I started out as a student of Susan's. I took some classes from her, and then I saw what she was starting and doing equine assisted therapy. And I saw how she did therapy and the contrast between that and the other clinical placements that I was doing. And I fell in love with it. And then I finished my master's degree. I moved away. I got married, had a child. That's my full-time gig right now. But reconnected with Susan, and now I'm working with her again, and I love it because it gives me so much hope for the work that this field can do um, by just treating people and not like a disease, you know. So I'm very, very honored and grateful to be doing this and to be meeting all of the people I'm meeting through this network. And yeah, I'm excited for the future because I see the tide turning. I see that the winds are shifting. So, and I think our time has come. So I'm excited about that. And with that, I'll follow Megan's lead and I'll pass the baton over to Joanna.
Yeah, just the same. I'm really grateful for this community. And I was working as a MFT as well, and got connected with Dr. Swim for my internship site, and found it to be totally different from everywhere else I was interning, because I was in private practice with a clinician who did attachment therapy, and then I was also at a psychiatric hospital. So it was very different. And when I started integrating her approach with my private practice, I saw the healing that was happening with people, and just talking to them as normal people, and listening to their traumas and their stories, and helping them find their own solutions. I'm so excited for the brainstorming that I've been doing with a team at Now I See a Person Institute. And I totally echo what Margaret and Megan say, of it gives hope to being a clinician, and it also is um, you know, exciting to see how the tide is turning in this space. With that said, just just a reminder that we're all volunteers here, and any donations that we receive go to furthering our research. And so I'm going to put the link for donating and being involved in the chat box if you all want to just take a look at that. So we can hopefully do more of this work and expanding it to some of the things that we might touch on later. Okay, thank you.
So I think that we are missing a couple of our faculty members, but I'm noticing the time. And I think that we're going to jump back over to Rod, because Rod doesn't have the time that he would like to have today. And I want to give him plenty of time because I think his voice is so needed and his ideas are so wonderful. And I'm so happy to call him my colleague and my friend. And every time I talk to him, thoughts generate into me of new things that I love to think of and to be able to share with my clients.
Same, and you always say kinder words than I deserve. So I'm Rodrigo Nardi. I'm a psychiatrist, a psychologist. I have a few enterprises in the field, pretty much all geared towards cleaning up the mess that mental health, commercial mental health became in America, or as I like to call commercial psychiatry. To the point that I have a network of providers. I have Ariel here with us, and the people ask me at times, why don't you get therapists? And I say they already know what they're supposed to do. My colleagues don't. So the idea is to always expand this service, this kind of a mindset to the people that do the worst damage, that is the prescribers we have in the field. And I don't know if this is the third or fourth time I'm participating in one of these events, and it's always so exciting. So the last time Susan reaches me, she says, "You want to talk?" I say, "Absolutely." And I say, what's the topic? And she says, faith. We're going to talk also about faith. And as she tells me that, I just have this sort of an explosion inside my mind, because all the time as we go through, how do we I always struggle to define what is that we do, right? I mean, traditional psychiatry has or commercial psychiatry, as I like to call it, has a very clear agenda. And the main value of traditional psychiatry is to suppress the human experience. And if we were to give the benefit of the doubt, which I think is fair, we could say that traditional psychiatry has as main value to generate well-being with drugs. Now, we have clearly a much more flexible and plastic and open-minded way to think of our job, but it makes difficult to explain then what we do, right? Because then you say, well, how can you, and American culture has this thing that if anything takes more than 5 minutes to explain, it's not worth it or something, or if you can explain to a 5-year-old, there was something like that, which is an absurdity if you think that we're talking about the human experience in going about life and, how many angles can we look at reality from that sense. But when Susan said faith, I had this boom in my mind, and I said, absolutely. I think a lot of what we do has to do with faith, and this, and please, I don't think anything that I'm going to do next is, if it sounds like preaching, please forgive me, because I'm not equipped to do so. But I frequently think of the Bible, and you don't have to take the Bible from a religious perspective. You can take the Bible for the metaphorical bits that it brings. And this topic of faith and change in human behavior made me think of, Moses, a history and or story, if you will, and how and that's pretty much what I would like to share, because there's a beautiful parallel between that and what we do for a living. So the whole thing starts with God making his will known to Moses, saying, you're going to go and you're going to set my people free from Egypt. And the people is captive there, right, according to the Bible. And again, just bear with me with the metaphorical value of it if religiously doesn't jive for you. So Moses goes about with his mission of setting a captive people free. And as he gets there, the Jewish people go, nah, who are you, right? Who are you, and what do you stand for? So then he goes about performing all these miracles, and the plagues ended up being miracles, right? So you turn the water of the Nile into blood, and the locust and the frogs and all that jazz. And there's a moment in the Bible that it says that God hardened Pharaoh's heart. So he would say, no, you guys are not going in, right? And there's a lot of debate in biblical communities about why would God do that if he wanted the people out? And that forces you to believe that's not just that. You can't just have the people out. There's something more to it. But nevertheless, Moses goes about performing all those plagues and miracles, or whatever you want to call it, finally until this terrible thing that is the death of the firstborn of every Egyptian family. When finally the Pharaoh says, yeah, okay, you can go. And that's also when the Jewish people says, we'll follow you. Now we're ready. Now we believe, right? And then comes the tougher part of this, because they're leaving Egypt, where they are in captivity, for a promise, for promised land, for something, okay, it's going to be better there than it is here. And as soon as they step out and they have to start walking the desert, they say, it was better when we were in Egypt. When we were captive, was still better. We could sleep in a bed and we had honey and this and that and da. And, and as these people walk through the desert, and I'm going to skip all the bits regarding the opening of the sea and all that jazz, but as they're doing it, at every small doubt, they want to go back. They protest. They come up with an idol made of gold because Moses vanishes for a few weeks and goes to the mountain. Then they have the problem with snakes and this and that. And it turns out that after leaving Egypt, they walk in the desert for 40 years. And, again, this is a matter of debate. What was happening here? Were they waiting for a whole generation of people to die so they could settle in a new place without that reference? Right? And then always makes me think of Lacan when he said that in a psychotherapy, one person has the knowledge and one person wants change. And the person that has the knowledge is the patient. The person that wants change is the therapist. Patients don't want change. They want to restore an old state of affairs. They want to go back in time, which is impossible, right? There's only forward movement in life. There's no such a thing as reversible brain changes, right? Change only goes forward. There's no undoing things. And the other matter of debate, then, if you look metaphorically to the Bible, is that, which I think answers the question of what is that we're trying to do many times. And one of the answers could be, we are trying to foster movement. We're trying to foster change. And maybe in lay terms, we would say we're trying to help people break their comfort zone. Because you can be captive, you can be miserable, but if that's the life you know, if that's the diagnosis you got, if this is the pills you have to take, if this is what life is about, what will it take to help people believe and have faith that after a freaking path of sand and thorns, you can actually find something better, right? And the kind of commitment that requires, and what is that makes us go through it? What makes us, each one of us, say, oh man, I'm gonna live this comfortable place that it's miserable, but human beings, one of the many fantastic things about human beings is our adaptability. We can tell ourselves, maybe we could use some moral psychology here to explain this, but we can tell ourselves whatever stories we have to tell to avoid discomfort, and to go against our own biology, because at the end of the day, our biology forces us to get into movement. Like I always say, a strong sense of purpose is the best antidote to anxiety, because anxiety is an endogenous experience designed to anticipate threats. And if you have no threats in your life, because Freud would say, right, we are kind of the civilization and its discontents, we gave up being out and about in the wild and exposed to the elements. So we have a civilization that keeps us in one piece. Boy, it's difficult to live here, right? So there's a price to pay for that, basically. But, every time we take a step out of our comfort zone, it's very rare in life. At times it happens by chance that you go from a crappy place to a wonderful place immediately. Usually we have to walk in the desert for about 40 years, which obviously is a metaphor, and we cannot wait. We're not doing generational therapies where we're not starting with grandpa and then finishing with the grandson. Hopefully he's going to have a better life. We got to take each life as it comes and try to help them find their way and believe enough. And that's where the faith word kind of drove me insane when Susan shared. I thought was just sheer brilliancy. So then you finally get to a point and you set yourself free of what your current life is now that has been hurting you so much, because none of us here are too inclined to believe that there's a biochemical imbalance in people's brains. We're more inclined to say you're trying to live an unlivable life, right? Or maybe, as some psychoanalysts say, the life inside of you does not match the life you have outside of you, and we have to kind of fix that mismatch. So it's painful, and what is that gets us through this process? It's pretty much faith, a whole lot of acceptance. But I feel that's secondary to faith, to believing something comes next. And then, as these things don't seem to happen by chance in life, I had a case that started working with me 2 weeks ago. She's this young lady who has 2 children, and she was from New Hampshire. And in New Hampshire, if you end up with an addiction and in the hands of psychiatric care, you end up with what I lovingly call a New Hampshire special. It's also true for Vermont and North Massachusetts, by the way. That is, you get exposed, you're put on a Suboxone for your opioid addiction, and also lorazepam or some benzodiazepine. This is also a controlled narcotic substance. And then you also put on Adderall, right? Because apparently everybody nowadays has ADHD. And pretty much, we're talking about an opioid that has some data, really keeps you away from opioids, reduces mortality, all that jazz, that is Suboxone. And then there's no data to support doing benzos for alcohol addiction. There's no data that supports that, and there's no data to support doing Adderall for cocaine addiction or crack, even though they have the same mechanism of action. So for a while, she's on this therapy in New Hampshire, and her husband is beating her frequently. And finally, she breaks out on her own of this captivity, and believing that in Rhode Island, her life could possibly be better. So she takes her children and leaves New Hampshire, comes here, and obviously runs out of all her medications, goes through awful withdrawals, and starts popping them from here and there in the streets. And by the time she reaches the clinic where I work, she was taking Suboxone from someone that she buys from the streets, right? And now, I need you to picture this lady. She's intelligent, full of life, but desperate. And she has guts, above all, right? She did what most people can't do. She said, I don't know what's waiting for me. I have to get out of here. But she was in a house, You know, she had a bed and honey, she had a husband, and it was captivity, but she was there and with her kids and sort of knew what was going to happen on a daily basis. But then, you know, she comes to Rhode Island hoping for this immediate transition between being a captive and the promised land. And she starts having difficulties. And so she comes to me like that. And I meet her for the first time. She tests positive for Suboxone. I say, listen, I'll give you a low dose of Suboxone. She was on 24 milligrams. I say, I think I can agree with 8. To keep you from this stuff, you know, I'll be testing your urine, unfortunately, here and there. The policy is to do every time I see the patient. I don't have stomach for that. It's like the institution tells me to suspect people. I don't like that. And then she leaves the first session very hopeful, right? Then she comes for the second session, and during the second session, she starts the session by saying how much she needs the Adderall. How much Adderall is a must, so she continues motivated enough to pursue her career, which I think, hey, it's a valid reason. If that's how I see drugs, if a drug can foster movement in your life, I'm willing to give you here and there. But I'm not willing to give you a drug that's going to make you tolerate an unlivable life, right? So she asked for that, and she starts with that. But I have an issue with the fact that she's already taking a controlled substance, and then I sense she's trying to go back to captivity because she's in her 40 years walking the desert. And right away, some days I am smoother than others, but you know, I really like what I do, and it messes up with my mood when people present to the sessions with this agenda that my field has created, unfortunately. So it's not their fault, but I feel like, okay, I'm trying to do my best here. It's kind of not my fault too. I'm just responsible for it. So I said, I have to stop you there. I will not prescribe you Adderall. This is not going to happen. I'm not going to put you back on this thing. I mean, most of my patients, they come to me because I'm cleaning that mess up. I'm flexible. I'm just not willing to go this far. And she starts crying a lot, right? And because her hopes really to go back to that, I don't know what it is. I don't know how to name it. I mean, and I may be wrong. You know, one thing that I have seen is people after using stimulants chronically for a while, the little we know about the brain, it does seem that you cause an atrophy on a bit of your brain associated with motivation. If we were to ignore that the brain is a very plastic machine, we would say, well, it may be too late for some people. And I have met people that were swimming on chemicals for so long that the likelihood of succeeding at tapering was pretty low. And the attempts usually go south, right? People just don't tolerate it. And they have what we call protracted withdrawal symptoms for 6 months, a year, 2 years, you know. But I said, no. Not going to happen. And she's crying and gets to a point where she says, well, you know, I have a phone of another provider that someone recommended to me that could possibly prescribe me these things. And then I told her, I said, listen, I would understand. I wouldn't be upset. I think you know better what you need. And then I remembered what these ideas that were in my mind about faith, and since Susan spoke to me about it, and I told her, you could very well go and find another provider, and eventually you're going to find someone that's going to give you the New Hampshire special, right? All the things you feel you need. But I don't have the privilege of not believing in you. I wouldn't be able to do this job without believing your capabilities, your capacity, all your strength, all your courage would not get you through these difficult times you're going now, struggling with motivation and things like that. So, and I said that to her almost, because again, I think, you know, it is a matter of faith, you know, to a fair extent, we have to believe people can be somewhere different of where they are. in one way or another. This is about movement. And I cannot tell you how tempting it is on every time this happens to just say, here's your pill, give me a good review. Right. I mean, look at people at some point in the recent history of medicine, Press-Ganey and Press-Ganey customer satisfaction surveys were forcing ED doctors to prescribe opioids because by saying no, their reviews were low and the hospital was giving them a hard time. Right. So but then there's this push towards, let's go back to the captivity. Let's go back to that place and not walk in the desert. But then I thought, well, if I don't believe in a promised land, if I don't believe something meaningful can be done out of this thing, how can she possibly believe? So I just shared that. I said, I don't have privilege. I don't have the privilege of not believing in you. I don't have the privilege of not believing that you can cope with life without this plethora of sedatives that basically make you insensitive to your reality. And God knows how much those drugs kept you in captivity before, being a victim of domestic violence and such. And I don't know if I said that, and I became a little bit emotional saying that, as frequently happens to me. But as I said, I'm going to schedule a follow-up with you, and you can decide if you show. And don't worry, I'm going to bridge your Suboxone low dose because she also knows eventually we have to taper that. We spoke about it. But I stated that to her, and I said, I'm going to schedule, and if it's your decision. I'll be here waiting for you. And I take her to the scheduling bits, and I go back to my office, and within 2 minutes, she comes back and she says, I'll be here next week, and walks away. I guess trying to answer the question of what is that we do for a living, I think believing is a huge chunk of it. Is a huge chunk of what we do on a daily basis is believing. We don't know where things are going to go. We don't know what may happen to each patient. We can't be sure of what's going to be. I mean, we fail, they fail, we falter. But without faith, without this bit of, okay, we may be walking the desert now, but there's something bigger ahead. I don't think the job will be doable in any sense. So again, Susan, thank you very much for inviting me and suggesting that topic.
Thank you. One of the things that was going through my mind when you were talking was that, I think that my life has always been driven that the people that I see before me are not broken. They're lost. They have been in captivity and they don't know what to do. And they are suffering so badly. And so they will attach themselves to any belief system that's thrown at them because they want help so much. And so what I find over these 4 decades is that people do not know they can heal. They do not know that that captivity can be broken and that the agency that they had in them still lives. And when we talk to people and we provide a space for them to see the belief that we have in them, then things start to change. I always feel that there's like this movement that I know that something great is going to happen because you start to see them breaking those fringes of captivity, whether it might be in their thoughts or their actions or whatever they're reflecting and the conversations that you're having with them. And for me, the conversations are not conversations of even symptoms, what you should do with your symptoms, what you should not do with your symptoms. People are there. We have to remember if we're going to, keep on to this captivity theme, people are there because they have suffered something that they had to cross that desert without any shoes. And most of the time that's in isolation. and the person who I often call suffering the most, right? But everybody's suffering if it's in a family. And so everybody's looking for a psychiatrist, a psychologist, a therapist to be kind of a deity and tell them, take this pill, think this way, and it's going to be okay. And as you brilliantly spoke about, that it is a process. And so it's a process for some that might be a little bit easier than for others. But there's so much of things that happen outside of the therapy session. And so for us to blame ourselves for people finding wellness or finding their way out of captivity or finding happiness, we're kind of barking up the wrong tree. We're there to accompany them until they can find that way to break captivity. And they find then their own ways of freedom. And I've heard some people, when I've said something like that, that they say, well, what if they want to do something that's not good for them? I've never met anybody that wants to do something that's not good for them. They might be doing things that aren't good for them because they're so lost. The suffering is so huge. They're just, it's like this panic of absolutely not knowing what to do, but they never give up. They're always in there trying to do something. And so for your client or your patient, because we call them, two different things. I just learned to pay, clients many years ago to try to take away that pathologizing of people. That's just why we don't do it. But calling someone a client is just as pathologizing. So, but you know, how do we get out of the way and allow people to have that self agency? So by you asking a question and telling them that you want them to get well and that you believe in them, that there's a path there. That is a huge gift. It's a huge gift that there might be some possibilities out there. And we need, I often see this like a big keychain, and there's all these keys on this keychain, and people are just in the dark trying to put that one in, trying to put this one in. But eventually, there's going to be a key, and it doesn't have to be the key that we provide for them, but it's the key that is provided in the relationship that we have with them. Because the relationship that you had with that patient, as much as you are a wonderfully empathetic and caring person, it's still a different relationship that you're going to have with another person because the contexts are different. So it can't be something that is rote, that I go in with this person and then I'm going to provide the same services. And it's hard because we're in a system that teaches that and promotes it. And so the voice of the person is one really never to be believed because these people are sick and broken to begin with. And that somehow we have to hold that knowledge for them and then convince them. I always saw this field. I was talking to somebody the other day, and they were talking about, I don't know if they're here today or not, but they were talking about that one of their siblings went to see a fortune teller. And that at the end of that, but that fortune teller actually encouraged this person to do some things that were very positive, and this person became asymptomatic while they were seeing this fortune teller. But then what happened is that when the money ran out, then they couldn't continue to see the fortune teller, and then they started rethinking it was just something that was not were they in a scam, right? But then what my mind went to in that conversation, how is that different from my field? Because it's the same thing. You have people that have good intent, they're offering ideas, but once that money stops, right, then they can't continue seeing you. I mean, I'm not saying you, but you know what I mean? And there's just so many ethical components to how we position ourselves. As when you say that, and I can't remember what words that you used, if it was that, you feel compassionate or tearful, you know, I applaud you, because I think this system that we're in tries to beat that out of people, that they beat out of people that you care about these people. And if we don't care about these people, how do we find the words to be able to talk with them? How do we share ideas of belief and of hope, and that there is an end at some point in time to being a captive? So, you know, I know Christina's here too, and it's so nice to see you. I'm on a phone. I don't know if you got this, but my computer wasn't working when I came on, like at 10 till. But that's the story of my life. Is there anything that you would want to add to this, what we've been talking about?
Hi, sorry, were you talking to me or hi. Yeah,
And you can just introduce yourself very quickly, because I didn't give you that opportunity, but I'm just trying to look at the time and make sure that we're, yes.
yeah, sure. So my name is Christina Winters. I'm a psychologist in Rotterdam, that's in the Netherlands. I operate my practice. It's called RAIN Psychology. That stands for Risk Awareness, Identity, Narrative, and Self-Continuity. I first came about this sort of way of thinking by learning about collaborative therapy, and I met Susan Swim through Harlene Anderson, and it's I have my own personal lived experience, and I think if we get into that, it might get into it later, sort of integrating it into the conversation. But yeah, I think that faith is an interesting topic to discuss, and what you were saying earlier, Nardi, about how you prefer to trust your patients, or you prefer to trust your clients. I think that there's a lot to be said about that. And I think that that's something that we should lean into more.
Perfect. Perfect. And so, because I've always talked with the people that have trained with me, and I feel the people that have trained with me has taught me so much about myself. But when I start to trust somebody, I can feel that relationship changing. It becomes such a more egalitarian relationship, as much as it can be, because we always have a power differential. But but when they have faith in me and they have trust in me, I'm no longer seen as maybe this deity that has all the answers and I'm going to be able to solve all the problems. They surely see that they have somebody that genuinely cares about their outcomes, and that I will do whatever it takes to make sure that somebody stays alive, or somebody is able to surpass some psychotic symptoms, or whatever that case may be. And you know, unfortunately, again, this is not something people are told that we have, that we're not allowed to do that, that we're not allowed to care. Like, like I've like it's the most interesting thought that that you know, uh, our field above any other needs that caring, because people are in the most vulnerable situations. We get to see them, and I think this gets forgotten too, but we see them at the worst possible times of their lives. And so if we all go back to the worst possible times of our lives, like surely we all had a diagnosis, because when you're going through hard times, it's difficult to survive. It's difficult to tread water. It's difficult to keep everything going at the same time. But those of us who were not identified with a mental illness diagnosis, we can then have sleepless nights. We can have incredibly bizarre thoughts, and we can think, I'm having incredibly bizarre thoughts, you know, but but you never think they're not going to go away. And Jim recently left, but Jim is this amazing lawyer that wrote the Zyprexa papers. And he has, I think, an organization called Psychiatry, and he stands up for the rights of people that have been mistreated in this system, and where they can think about perhaps the legal consequences that should or should not happen to prevent this from happening to further people. And so he sent the information and this chat, and at the end of this, that we can read the information because people won't be able to see it when we do the recording. But we were having a conversation, and what I think is so important, and I just really want people to remember this, is that before the 80s, before the mid 80s, people weren't put on medication. A psychiatrist was a listener. They were someone that healed through conversations. They didn't just put people on medication and say, this is genetic, because that had not come out yet, and that you're not going to get well. Instead, the medications were talked about kind of broad, what you talked about, in a way, that these are rough spots to get over. And then there's an end to the giving of the medication. And so for those of us with this longevity, to see the change that's happened since people now have a biological somehow dysfunction, and that this biological dysfunction will lead into more dysfunction and more hopelessness and more captivity. When you were talking about all the people taking speed, I was thinking about the 60s and 70s. Everybody did drugs. In my high school graduation, I think it was 3% of the people that didn't do drugs. Not only did they do speed, but the amount of hallucinogenics that they did was just mind-boggling. I mean, I remember at my high school graduation, they're passing around, LSD, and I'm like, don't you realize our parents in the stands? Like, I'm just like, I couldn't wrap my mind around it, that people wouldn't just like go crazy, knowing their parents were there in a big stadium. But I guess for them, it was a lot of fun, and that's fine. But during that time, people didn't stay depressed. They didn't stay depressed. There wasn't suicide. There wasn't, I mean, like, you might hear about every once in a while, but things got so much worse when we decided that fetal alcohol syndrome, or the brain barrier, or all these types of things that, so many of people have spoken to, that how can we put that type of empirical data on things that are like also heartbreak, or love, or righteous anger, or isolation, or hope. And I think we often lose track that these people are at the worst days of their lives. And so when we go in there, how do we want to ethically go in there, realizing that these are the worst times, and that we match that with the compassion that we have for them, instead of seeing them either as a cluster of symptoms or a cluster of money? Because that's the other thing. I know with what we evolved to at Now We See a Person Institute, the reason why we can have solidarity with the parents, that they can be the ones to be watching their husband, their wife, their children, while very dangerous things are going on, is because the trust. They have trust in us. We have trust in them, that we are going to be able to manage that together. When I talk about that I've never hospitalized anybody or put anybody on medication, it doesn't mean that I was trying to not apply good standards of care in any way. It was that I was raised in a time in the field when that was not seen as best practice. and it was seen really as not best practice for a lot of people at that point in time. I'd say for a majority of the people, it was a really kind of this revolution. And so when you know that putting somebody in a hospital and accidentally taking away every rights that they have as a person, and then the diagnosis that they have is going to follow them, and then knowing that the medications is not the answer anyways, then that ability to provide these context for safety and for, again, like just creating little like openings in this captivity is possible. You know, I don't know if this would be a good time, but I had asked for Megan to give me a list of the people that were with us today. And I think we have somebody with us today that kind of experienced that captivity. And I'm not sure if they would want to talk about it and add in their voice. But if anybody that has had those lived experiences might want to comment on that, I think it's so incredibly helpful. And it says, okay, so Rod, you're going to need to leave us. We will, is that what you said, right, in the chat? Okay, perfect. And so then maybe what you can do is that we can connect next week and talk a little bit more. I have that information that you needed. And I thank you so much for being with us today.
Thank you. I'm always very thankful for this, and it breaks my heart. I'm going to miss all of the insights that come after, as this thing progresses. But I have this, as I told you, there's this person needs my help with something, and it's someone that is growing in importance in my life, and I'm also doing my healing. So, thank you for the opportunity.
Always. Thank you. Thank you so much. Bye. So, let me just see so maybe, I don't know. Let me just see who we have here today, and I can scroll down. And maybe some of our recovery consultants, I don't know if this would be a time that maybe you would feel comfortable in kind of adding to these ideas that we were just talking about.
Dr. Swim, I wouldn't mind speaking.
Perfect.
Okay, sorry. I'm not on camera because I am taking care of my 9-month-old and to get myself together.
Perfect.
I'm having trouble unmuting myself.
Oh, we can hear you wonderfully.
Oh, you can hear me? Okay. Okay.
Mm-hmm.
Hi, everyone. My name is Hannah, and I have been introduced to Dr. Swim. What year was that? Was that 2023 that we met, I believe?
Mm-hmm.
At a time of a lot of chaos in my life. And I had been subjected to several involuntary hospitalizations just due to the way that I was dealing with trauma in my life. And a bit of background on that. In 2015, my sister, who had been diagnosed the year prior with several mental health diagnoses, including schizophrenia, among other things, and bipolar, which they love to slap that on everyone. I think that's kind of a rite of passage. If you go through the mental health system, you're going to be called bipolar at some point. So she had passed away in 2015 by suicide. And it was a very traumatic situation, especially because I was the one present when it happened. So, as you can imagine, it was very difficult. And I lived in kind of a state of shock for a long time after that had happened. And my belief system had been shattered. I know we're talking about faith as a topic, which I appreciate. But my belief system had been so severely shattered by this incident. And hey, buddy. Yeah, so I naturally was having a hard time coping the years that followed. And, I kind of stayed in school. I kept my head down. I finished what I was supposed to do. I was kind of going from job to job and never really took a break or a pause after experiencing this trauma. And so the wheels started to fall off. And I ended up in several dangerous situations because I was kind of living a bit recklessly. And, my family was worried about me and they thought the best thing to do would be to hospitalize me. Which I don't think helped anything. I know didn't help anything other than to be able to share my experience now and hopefully help others. But what I discovered on the inside of mental health facilities was really heartbreaking, angering, maddening, and upsetting on so many levels. When somebody is hospitalized due to mental health, they have no agency over themselves, over their bodies, what goes into their bodies, over their movement. It's not a place where I would send anybody who was going through a hard time. You're essentially locked in a very small corridor hallway. One of the places that I frequented, unfortunately, you were not allowed to go outside, so no fresh air. If you got upset or expressed yourself or your desire to leave, you would be forcibly held down and injected with, whatever chemical restraint they were using at the time. And, it's like you feel like a prisoner of war, and it's like if someone's going through the hardest time of their life, I'm not going to lock them in a closet and inject them with drugs. I'll probably take them out into nature and just talk to them. Maybe listen to music, maybe just hear them out, sit in silence, read. But I was subjected to tormentous rounds of violence, of ridicule. There was not a level of professionalism with the staff, with the nurses. They would laugh at people who were dealing with, delusions or, outbursts. They would laugh, joke, make jokes about them. They would belittle you when you tried to explain your situation. Um, it was awful. It was honestly hell, or what I would imagine hell to be. And I feel like because I was so lucid and not one of the more severe cases, and I could kind of see what was going on and speak up and raise my voice, like as far as like when I saw them laughing at people, or when I saw them you know, just unprofessional behavior, they would kind of punish me, I guess, by chemically um, uh, dosing me with the needle, having me restrained, calling security, just for using my voice and speaking up and saying, this isn't right, this isn't professional, this isn't human. Not only is it not professional, it's not human, the way you're treating not only me, but these other people here. And so really, your whole life is at the hands of flawed individuals. You know, your safety, your just everything is decided by people who may not have much compassion, may see this as a way, their position as a way to feel better about themselves and their situation, or take out their frustrations, because no one's really watching, and you lose your credibility once somebody labels you. So no one's really going to believe you. And yeah, so it was just a really horrifying experience. It caused a lot of turmoil, not only internally, but in my relationships with the family members who had put me in this position. And I really just would like for us to reevaluate, just as a society, what we're doing to people, and what we want our legacy as this generation of humans to be in this world. And you know, I there's really so much. Sorry, I'm trying to I don't want to speak too long or take
Oh,
up.
no, what you're saying is just so important. And, because I did journey a little bit with you through that, one of the things I can remember is calling up the hospital
Mhm.
and really being shocked. Although I had worked in hospitals when I was um, a young clinician, not for very long, but each probably one putting myself through my master's program, and then one when a friend suggested I do it to make money, which I made a huge amount of money working in a hospital. And um, it the what I would see is that people would come into the hospital and they would be suffering, but there was no suffering like what happened in the hospital.
Mhm.
And then when they left the hospital, they were more confused about their self identity than
Yeah.
before they had ever went in.
Yeah. That is so spot on. So spot on. Being confused with your self identity, which is why I so much appreciated what was said earlier, about trusting your clients and trusting like that they know themselves and what's good for them, because there is absolutely no trust um, in the current system, placed on uh, victims of this system. And I call them victims because they are. Um, and you're treated with suspicion. You're treated with it's just a very bad faith practice. And I even remember um, at one point, well, I would talk on the phone. You don't really have privacy on the phone. So you're talking about sensitive issues and everybody's listening. And then they're commenting on your conversation afterwards. Like, oh, I didn't like how you said that. Or, oh, you should, as if, like I'm asking for a critique on how I should feel and how I should express myself to my friends and family. And there was one nurse in particular, I remember, who started a conversation with me kind of in that way. She was listening to my conversation. And I think she asked me, somehow it got brought up like what my plans were for the future. And I told her that I would be going into an accelerated master's program in nursing. And had been in my prerequisites working towards that. And she laughed at me and she said, "No, you're not." She said, "You can't get a master's in nursing if you don't have a bachelor's in nursing." And I explained to her, like, no, there's a program where if you take your prerequisites, you can, and you already have a bachelor's in another field, you can apply to start in a master's program for nursing. And she's like, "I don't believe you. Like, you're just crazy. Like, that's not going to happen. I don't see you doing that. You're not going to be a nurse practitioner." And it angered me so much that what you think because I'm in this place, like I have no intelligence, no value, no understanding of the path that I'm embarking on, that this is all some sort of delusion, that I haven't been working towards this for the past couple years. And it was so upsetting. And I got so angry with her. And she said, "If you were my child, I would beat you." That's what she told me. And I said, "Well, thank the Lord that I'm not your child." And I'd like to say, for the record, this year I was accepted to Vanderbilt University for their nursing, their accelerated master's program in nursing. It's one of the top programs in the country, and I'll be starting in the fall with a child, and I'm doing it. And I don't care enough to go back to the hospital and tell this nurse, "I told you so." But healing is possible. It really is possible. And it's just so important that people who go through the tyranny of the system understand and hear the voices of people who've gone through it and have come out of the other side better. And not to say my life is perfect now or anything, like I do still deal with the trauma sometimes of what I had been through. For example, the other day I had to get some vaccinations for my son so he can enter daycare. And holding him down and having the nurse put the needle in his leg hurt me so much. And it just brought me back to me being held down and having somebody put a needle wherever in my body. And it's like they just don't even think about the implications of what they're doing to people and how long it will affect them. And so, anyways, I'm doing a lot better, and I know the topic was faith, and I didn't really touch on that, but faith is a huge part of my healing, and I just think it's so important for us to share our stories and to not be ashamed of it, because honestly, we're more than survivors. Like, I think people who go through these systems are heroes and come out of the other end. It's nothing to be ashamed of. I think it's a badge of valor to be able to be vulnerable with such horrific travesties that you've been through, in aid of helping someone else see that this is not the end of their story and that there is so much yet to be written. And it's not going to be written by people who can't even bother to have a respectful conversation with you or see you as a person. And yeah, so I just want to thank Dr. Swim for the opportunity to speak. I don't want to take up too much time, but yeah.
No, I think your voice is beautiful. I think that, one of the things when I've mentioned this to you before, but with your experiences, then you're going to be able to continue what we're trying to do, but in so many different ways. You know, when you find somebody, especially, you know, I used to, you know, I'm not going to have the degree that you have, but when I had a nursing degree, I remember that the least amount that was looked at was how the patient was coping with the trauma of being sick. It was just completely ignored. And it used to break my heart that that people weren't seen. And I think it can become very dangerous, not just in mental institutions, but in physical institutions. Like we have to believe in that person to learn even of what their symptoms are. And you see such a dismissive nature that permeates against this field that was supposed to be a field of compassion and nurturing people back to health. And when we do not see them, we miss so many different things, regardless of what we're going through. And we just need that one person at that right point in time to say, like, yeah, you know, I would be reacting the same way because I did react the same way, or whatever the case might be. And, you know, I hate to make this so dramatic, but I get to because, you know, by longevity, but that can be the difference between life and death for some people.
100%.
Mm. Yeah.
100%.
Mhm.
And that's why I think it was so important and like pivotal in my journey that I met you when I did,
Mhm.
because you never treated me like I was crazy. And it's like I knew I wasn't crazy, but like when you hear so many people with like years of clinical experience and oh, this doctor who studied here and here and here telling you, no, but you're actually crazy. Like, no, but you actually have this disorder. And your belief that you don't is part of the disorder. Like everything you do is pathologized. Everything you do is in aid of their diagnosis. So to hear just like the simplicity of like, no, like what you've been through is horrific and it makes sense that this was your reaction. Like, of course you reacted. Of course this is where, you know, certain things landed. And you're going to be okay and it's going to get better was completely a game changer. And so many people in this life, I think we're looking for permission to believe in ourselves. We're looking to other people for permission to hope, for
Mhm.
permission to reach for things unseen, right? And so just those words were so powerful and helped so much with me saying, trusting my inner voice. And like, I knew I wasn't crazy. Like, I'm just going through a rough time.
Right.
And I might be the sanest person I know. So, anyways,
Or the person that you trust the most in your life, which you should be.
right.
You know, one of the things that happens is that the, you know, psychiatrists, psychologists, master's level therapists, life coaches, like they're taught to accidentally invalidate that voice. And so they they'll hear a symptom like someone is uh let's just say throwing something in the house, which wasn't something that is related to you at all. And then they're told by clinicians to do these actions that they've read about in some book, or someone's told them that this is something effective. And then all of a sudden things start getting worse. And then things start getting worse. And then because it gets worse, we don't ask ourselves as practitioners, so what did I do wrong? Right? Why is this not getting better? Instead, it's blamed on the victim, who was a victim to start with. And then when people become completely voiceless, what options do they have than not to become symptomatic?
Mhm. Completely agree. Yeah, I think we just have it so backwards, and we're trying to just pathologize and humanity. And there are so many bigger symptoms and reasons in the society why people feel hopeless, why people feel depressed, why they don't feel they have a future, why they get suicidal. It's because of the circumstances of their life, you know? And it's like this, it goes with, the capitalist. Ooh, uh-oh, hi, buddy. Sorry, my baby. um, when everything is for sale, and everything is for a profit, um, people lose their humanity and they turn into numbers. And that's what we're seeing happen on a mass scale. People are depressed because they feel like they can't afford to have the life they want to live. They can't afford to have families. They can't afford to, feed themselves. They don't have hope. And so they're ending up getting medicated for things that are societal issues and silenced because the people who are benefiting from their oppression are, not willing to make a change, obviously, because it's benefiting them, or so they think. And so, yeah, anyways, I might have to go back on mute to tend to
Thank
my
you.
baby, but
Thank you. Tell him hello.
thank you so much.
Thank you so much. So, I had asked one of our other participants if maybe, since this reminded me of some of the things that they were going through, if maybe they would like to also speak, kind of maybe reflect on what we've been talking about. And I had just texted them a few minutes ago, and would now be a good time to do that if you would like to. Yeah. Mhm.
Are you talking to me?
I am talking to you, you handsome man. Nice to see you.
You too.
Long time no see.
Yeah. Well, I mean, a lot of what you guys have been talking about rings true from my point of view. Um, and I like that the person who you can help me with his name. He
Right.
he tied in faith and trust. Um, we were in a situation where it just seems like the diagnoses drive everything because that's how people get paid. And it's not any one person's like fault. I mean, I'll be honest. I want a solution when there's a problem. We all do. And if it's a if it's a pill, it seems like such an easy, quick solution. But it's a terrible thing because it's so the the once there's a diagnosis, it kind of biases everything else. And I can get more specific if you want me to
Mhm.
in sharing my story, but it seems to me that that's what happened.
I think that the stories that you guys have, like Rod, is a psychiatrist, so his story is better than my story. I'm a psychologist, and so is Christina. So our stories are kind of, but and then the rest of the rest of our team is so, they have their own degrees, but your story is much more important than our story could ever be in talking about your story.
Well, I mean, it's on many levels. My wife and I were having problems, And that us getting through that required a much different approach than initially was attempted. I mean, it, it meant a lot. It meant the world that someone is showing trust and faith in our ability to solve our own problems. That allows us to actually solve our own problems and work on it. Well, not every problem doesn't get solved, and sometimes it was actually important. I remember a lot of times you would just say, I don't have a solution. I don't have a magic solution. I mean, you're so sincere and honest about that all the time. And that's a huge difference. But then at the same time, not giving up and actually continuing to show that you believe in me and believe in us as a family. That means the world. And when that's broken, which was what happened before, it was just a cascading disaster. When you don't even, there's words that aren't even said, where I was getting a feeling that the person we were working with really didn't think we were worthy of having children on this planet. And that crushed me inside. I mean, I know that not to be true, and I won't accept that. But people have problems, and it's complicated. But showing that kind of lack of faith in us, and usually there's like one person who maybe has a diagnosis of some kind, and then everything is biased against them. And I wasn't on, that would have been a lot worse. I can't even imagine what that would be like. And my son Simon, one of my sons, he went through a lot because people were telling us that he needed this medication for his own safety, and I believed them, and that was a huge mistake. And his brother and his brother Tristan and Simon were both telling me, it these medicines need to stop. They're not helping. They're making things worse. And we even were looking back at old pictures the other day, and you could see, you could just see the weight of what these medicines were doing. They definitely weren't helping. And I wish from the beginning we had found other solutions.
And I remember you telling me that, which sometimes just is so crushing to me, that we were the only voice that said something differently. Like every
Yeah. Yeah.
at length.
We made a mistake. First, we worked with people. It was free. It was a free program during COVID, and it was people training to be therapists. And that's how we ended up with this other therapist. And it was just like, I'm sure everybody in their own way was trying the best. It's just a matter of their strategy was not going to work, because of the most important element, I think, in what you guys do, which is show someone you believe in them. And that's probably, and you don't show it directly, you show it in other ways. And then if someone believes in themselves, they can begin to solve some of their problems, which you're never going to solve all your problems.
Well, maybe you can, but then new problems will come, right?
Yeah.
So you're always on the way, right?
But you're never going to make a problem worse. I mean, I come from, I'm a high school teacher, and there's a lot of ways we can create worse problems. And if a student has a positive experience, you're not going to create worse problems. And if you show them you believe in them, no matter what happens, they're not going to create worse problems. But if you give up on them, you're creating an even worse problem, because then they're not going to believe in themselves. It's sort of parallel of that.
And it's so almost unbelievable how well-meaning professionals can teach you not to believe in your family, right?
Yeah, yeah, that's pretty well said. And our kids were telling us, Simon was begging us, please get me out of here. And it would break my heart. Because then, even a lot of my dear friends were like, they were talking about, oh, he's a liability, you could lose your house if he does blank. It's just based on fear, really. And we're somehow, it's kind of pervasive that you give kids medicine to fix their behavioral problems. It's sort of pervasive, and it doesn't really work. Kids got to decide they want to behave.
Well, and I think that is also, in my experience, that kids want to do good. And
Yeah,
so when they're so used to doing bad, they don't think that good is ever possible.
yeah,
And,
yeah.
at one point in time, I worked in like this consulting in the schools, and I used to have the kids that were the worst kids mainstreamed into honors classes where they had these really cool teachers that were like doing these really cool things, and they emulated the other students. And people were like, no, no, put them in special ed. And I was like, no, they've been there. They've been in worse than special ed. Give them a chance. And they did marvelous with those chances. And it's so sad that we have so many children that are on basically speed. It's amphetamines.
Yeah.
And we don't know what the long-term effect is. I'm hoping that it's like similar to like the 60s, 70s, when people were on lots of speed, too much speed because it was recreational, right? And they turned out okay. They turned out to be probably senators right now, you know what I mean? But but these are children. They don't know why their minds are racing. They don't,
Yeah.
you know, they don't understand any of this. Or, and one of the things that I remember with you guys is that, we had some of our recovery consultants come in and say, I was worse than your son, and which was, of course, probably hard to believe, but it was one extra voice that was saying that, well, maybe things can be different. And then I can remember you guys when the medication started to be tapered off. And that was the belief part, because
Yeah.
you didn't have to believe anybody else except for what you were seeing.
Yeah. It was really scary because Simon, there was an effect on his, was it a twitching or something?
Art of dyskinesia was starting. Mhm.
Yeah, and that really rocked me. It felt, the whole experience felt like it was an uncontrolled experiment on my kid.
Mm.
And let's try this. See if it works, see if it helps. And
Mhm.
it was all based on our anecdotal discussions that were like really not that much different from any other parent trying to help their kid behave.
Mhm.
You're just trying to fix things, and it's like there's no simple solution. There's no pill. You just have to like figure it out. But everybody, including myself, wants an easy solution. And there was a guy we worked with it was all online at the time, and I think he actually quit. And I want to think that he quit because of the issues you're talking about. I want to say that because I just got the feeling this was a really good guy.
Mhm.
who really took the time and cared and realized this pretty fatal flaw that he's giving kids medicine as an experiment. And yeah, he said clearly to my wife and I, Simon's issues, I believe, are behavioral, and he doesn't need any medication. And he was super clear about that. And he said, and I'm not doing this anymore. I'm actually quitting this profession. But I have a feeling Simon may have had an impact on him.
Yes.
The Margaret asked if anybody informed me. I'm pretty sure they did. I mean, it's overwhelming.
Yes. So go ahead.
Can you still hear me?
Yes. Can you hear
Oh,
me?
okay. It said I was muted. I was just gonna try to answer Margaret's question. Just when you pick up the medicine, there's this long thing, and you know, someone probably did inform me, and in writing, at least, I'm sure they did. It's just that you don't read all the fine print, and that when that started happening, I was that's when we definitely pulled the plug immediately.
I was just thinking that I think your wife is here too. I didn't know if maybe there was anything that she would like to add. You can stay off mute too, because
Okay.
I think what you guys might have things to add to each
I,
other's story.
I also I wanted to add that this particular drug is so asked for and needed, supposedly, that we went through so many periods where we were really stressing out to get it. And the irony is maybe nature was trying to tell us something,
Right.
because it
Exactly.
was really hard to keep him on that medicine consistently. And the other thing, I know a guy who's older, who's coming from the opposite point of view,
Mhm.
where he really believes this medicine helps him.
Mhm.
And I can see where, I mean, he'll just talk endlessly. And I love this guy, but it's not, it's a perceived thing from, it's not helping him survive socially at all. It might help him get more done in a day, but it's not going to help him live a human life that he enjoys with healthy interactions.
That
It's,
is that is such a that is such a brilliant statement, because the people that I talk to, and I think there's people here today that can speak to that too, but the people that I talk to that go off of it, they say, I have to allow more time to study, or I might have to, you know, will schedule time to study, where before they would just stay up all night. And there was
yeah,
actually a gentleman that was going to join us today, and I think he's going to join us for our next one. But I'll send you his article. His son ended up not being alive because of this.
yeah.
And
I listened to that.
so he speaks to that, and it's talking with him was so sad because we had a conversation, and it was just, you know, the issue is that more people just do not know about this. They don't know. And so
Yeah,
they're kind of just copying, after what either that they're reading, or what maybe their colleagues are saying. Like Rod had, the last time he was here with us, or maybe the time before, but he wrote an article on this and I may or may not have sent you his article. I've told him how helpful his articles are, because again, he's a psychiatrist that's writing these, and he takes people off medication. He doesn't try to put people on medication. And he asked, his colleagues if they would put their children on these medications. And the answer was none of the colleagues said that they would. And there's something wrong when the people,
Yeah.
the professionals, that they aren't going to prescribe this.
Are you saying that given the circumstances where they felt like their kids were being suicidal or something, you're saying these professionals would not
Mhm.
even consider?
Mhm. And
Is that the question?
the difference is that if you go to your GP or you go to your pediatrician or you go to your, I don't know, gynecologist, which you wouldn't go to, right? But what happens is that they do not do this over and over again. And so they
Yeah.
do see it not succeeding, right?
Yeah.
And so they're more likely to prescribe it than people that do this for a living.
Yeah.
But that was
Oh man.
his experience with his colleagues. And he wrote
Wow.
about it, that where's the informed consent, right? So if we know that something's not working,
Yeah.
then how can there be a legal informed consent?
Yeah.
So, but I thank you so much because, you know, you guys are the heroes. You know, what I see for really for so many decades is that it's the parents that heal each other. They either heal each other or they heal the children. It's the love in the family that kind of has been pushed aside because of the diagnosis. That then once there's that paradigm shift, that things just flourish because you guys aren't broken. You know, it's not like, you know what I mean? Like you're just treated like you're broken.
Right.
So I was wondering if maybe your wife would want to come in and add to this.
Yeah. Yeah, that'd be great. I think she said she was on mute or something. I can't figure it out.
Okay.
Maybe.
Like someone muted her or
Yeah,
we
I
need
don't
to,
know.
we need to unmute her. Is that
Maybe that's it. Let's see. She'll probably respond. She can't unmute herself for some reason. Maybe the settings.
I'm here.
Oh, there we
you
go.
are?
And I don't know how
Hi.
to include video, so it's just going to be my voice for now. Hi.
Oh, that's perfect.
I
Hi.
am I am Donald's wife for 22 years and Simon's mom, and I will share his experience with whomever will hear because it's a perspective that is so important and an experience that almost killed him. So he was diagnosed with ADHD after a half hour, maybe 45-minute meeting with an online psychiatrist after COVID started. And some of her, besides the questionnaires I filled out, Simon's a really active kid. He's super bright. He's 1% away from being considered gifted with the Johns Hopkins Institute. He's physical, but he's super hyper and he gets bored easily. That was pathologized. That should have been recognized as gifts. We have a gifted kid who gets bored easily and is distracted in school and distracts other kids. Maybe the child's not the problem. Maybe the system could have looked at him and uplifted his gifts, but that's not what happened. We had complaints from teachers, and he taught himself to read by the time he was 6. And of course, school was boring because he already knew how to read. He didn't want to sound out vowels for 3 months. But being concerned after COVID started that he couldn't follow with Zoom school, I called a psychiatrist and asked if they would give their input. And they said he had ADHD. They prescribed something called guanfacine. And the next meeting we had, they increased the guanfacine, and they did it again the meeting after, and then said that he should try ADHD medication, the stimulants. And because we were during COVID and there were shortages, over the year that followed, he switched types of methylphenidates 5 times. Focalin, Ritalin, Concerta, my brain will forget them one day, thankfully. But he went through a rotation of all that on top of the guanfacine. And within a month and a half, his behavior wasn't getting better. So they increased the stimulant. I think it's, when I look at the system now, and you all work in it, is that it seems, in my experience, nobody put the brakes on and reevaluated the initial diagnosis. They all ran with it. So obviously, if the medication wasn't working, he needed more. And he became unsuccessful socially. He was impulsive. He was weird. Other kids would distance themselves. He could feel the negativity from teachers, even from his own parents. He was in what I refer to now as a pharmaceutical prison. And it breaks my heart to say it, but I was giving him medication that made him hyper and impulsive. And he was then scolded and unsuccessful socially because he was impulsive and hyperactive. And no one along the line said, let's reevaluate what the first psychiatrist said. And within 2 weeks of him being given antidepressants because he was depressed, he hung himself in him and his brother's bedroom. He tried. And that's the first time he ended up in the ER. He knew not to talk to us about it because him and all his friends know that if you talk about being really sad and thinking about suicide with grown-ups, that the law says they have to bring you to a hospital. So not only is he in a pharmaceutical prison, but he's in a, I can't reach out to anybody or I'll be sent away, and I'm sad and I'm 11. And I'm doing right by him now, but I will always carry the sadness that I was part of creating that pharmaceutical prison and going along with the harm that was done to him. The second time they changed antidepressants on him, he also had a suicide attempt. And I'm blown away because I'm not an expert, but how nobody intervening along the way said, hey, he switched antidepressants twice and tried to commit suicide within 3 weeks of both times. Maybe something's off. Instead, they just kept giving more and more medication until the last time when he began showing signs of tardive dyskinesia. He was 12. He was on antidepressants, almost the highest dose of stimulants, guanfacine, and now they had tried adding Abilify, to which he had a terrible reaction, beat me and my face till I had to be removed by ambulance. And then they returned him home with extra antipsychotics. And I couldn't see my son anymore. I couldn't see his soul. I could see his face, which was starting to twitch. I could see his eyes, but I couldn't see that human that I knew. And that's when I decided with Dr. Swim that it was time to stop this cycle of medication and peel the layers back to understand what was going on. And what was going on is that the medications were causing symptoms, and those symptoms were being medicated by more medication. That's why I couldn't see my son anymore. He was hidden behind all these layers of medication. And when I asked the doctor, he's 12, he's almost on the max dose. What's the end game? What does this look like when he's 18 or 40? And the response was, well, he'll have developed tools to learn to deal with his depression, his anxiety, and his ADHD. And that's when I stopped believing. I thought, these people don't really know what they're doing. They think they know, but all of them were okay with him changing types of methylphenidates 5 times in a year. I don't know that any study's ever been done on a child's brain to see how that affects the pathways in the brain. And now my son, I think what was really helpful is when we started weaning him off the medication, we put him in a surf camp for 3 weeks for kids with special needs, but he didn't end up in the bucket of kids with special need. He ended up with a junior instructor jersey. And for 3 weeks, he was in the ocean 5 hours a week, helping other kids, being seen as competent, not being a patient anymore. And now we're 6 months down the road. And if you ask him, he has no anxiety, no depression. He hasn't thought about suicide. He's eating more. He's growing more. and he's on top of his homework. Nothing is late, and he's got all A's and B's. So I know that with the guidance and the empowerment of Dr. Swim, to believe in our own instincts, and our own instincts, my own instinct was telling me to stop going along with this. Once she empowered me to do that, I was able to do that. And I was no longer scared of this against medical advice label that we have in California. I don't know who here is from California, but if we don't go along with what a doctor says or asks, we could be signaled to DCSF as going AMA, against medical advice. And that is terrifying. He's doing great. He has passions, he has friends, and hopefully in time, this experience he had will fade, and his attachment towards us are building stronger. He didn't have much towards us when he came back from these hospitalizations and these treatments, because why would he trust us? I get it. So that's all. I'm sharing my story so that, you know, hopefully next time you see a kid who's labeled with ADHD and is hyperactive and impulsive, that it might not be what his soul is. It might be what the medication is inspiring, for lack of word, him to be. Thank you.
I wonder if I could just ask you a couple of questions, because I think that you're a wealth of information. So one of the things is that you saw a plethora of psychiatrists, psychologists, marriage and family therapists, and social workers, because you know, at one point in time, I think that, you know, when a child, you know, hits their parents, you know, they think that he is a danger to others, not just a danger to himself. And so they were thinking about putting him in long-term institutionalization. And we're really pushing for that. And you guys were the hero in that story, because you were able to help convince the courts to not do so. Could you just talk
Right.
a little bit about that? And then
There's
I'm gonna ask you just another question behind that. Mhm.
okay. There's 2 points to that. One, because I was the victim of his assault, which bruised my face from my forehead to my chin, my voice was invalidated. I kept reminding people that he was on day 3 of weaning off Abilify, that I had been reaching out to the psychiatrists, to the doctors, saying the Abilify is not working. He's being weaned off of it. He's acting really erratic. This doesn't feel right. But because I was the victim, in their words, I was thought of as overprotective and overbearing and trying to remove responsibility from my son, when in fact I was the closest caretaker who could see that his erratic behavior began when the Abilify was added, and that it got worse when it was being removed. Nobody paid attention to that. They attributed his behavior to him being deviant. And it's something I encountered throughout the whole system. The system as a whole doesn't seem to be designed for the social workers, psychiatrists, therapists to take accountability and readjust the routes. And the second point about convincing the judges, well, that was a big smokescreen on my part. I knew I didn't want to send my son away. I knew that he needed to be loved from his family to heal. I never would have, they would just have placed him in 5 states away on a different coast for a year and continued increasing the medication. So I pre-authorized 3 different facilities. I pre-cleared insurance with 3 different facilities. And after this attack, DCSF had added a clause in their complaint that my husband and I were now incapable of caring for our son, and that the state would be more capable than us. And I still tear up thinking about that, because as a parent who loves their child, who's not abusive or neglectful, I filled out foster care intake forms on Mother's Day, because the system as a whole never put the brakes on what was happening to take accountability and revise what had started this. Before he was on a medication, he was just a hyper annoying boy, like he should be. He is smart, he's bored, that was pathologized. And nowhere along the line, to the point of tardive dyskinesia, removing him from our care, placing him in a high security facility for a year.
With
it was
children,
always pointing at him and us.
But I'm going to stop you. With children that were adult teens, that they were, because of, they considered what he did was so high acuity that they didn't place him with peers. They placed him with older teens where he was in a continuous state of anxiety.
Correct, because when a child under 13 attempts suicide, they can no longer be treated in groups of kids under 13. They have to go in the 13 to 18-year-old groups. So for the whole year where he was receiving IOP, PPE, not PP, PHP, he was 12 put in groups of 13 to 18-year-olds, which had issues of sex trafficking and methamphetamine use. He was exposed to so many problematics that were above his age comprehension that should have ever been presented to him. And it added to his anxiety.
And I think the other thing that I just would like for you to lightly touch on, although we could spend like all day talking about this, because I think what your family experienced was so something that shouldn't have happened. And
Do you want me to mention the therapist who diagnosed me and shared it with my husband and not me?
yes.
Yeah. So my husband and I went to seek a family therapist who was going to work with us individually and as a family. And at meeting number 2, she said, I'm only going to work with the couple, and Carolyn and Simon need to be in therapy, not Donald and Tristan. And I was a bit shaken because it felt like she was saying, you two are the problems, not the other two. Meeting number 4, she requested to be with my husband only. She proceeded to open the DMS or DSM book, and she read a few symptoms. And she asked my husband, does that sound like your wife? And he said, yes. And she turned the book around, and there was covert narcissist on top of the book. And she asked him to please never tell me this, and never tell our children, and never let it leave this room. And that this was going to be something they would keep between her and the intern and my husband as they continued treatment. And so for a year, I went to therapy. And I would leave therapy just telling my husband, like, I feel so unseen. I don't know what's happening. I don't quite understand what's going on, because I'm having a sort of things reflected back to me that I'm not connecting with. And over time, this made me feel not seen. I was having reaction and advice given to me that didn't quite fit what I would hear normally, or what had been said in the past or how I saw myself. And this led to so many troubles. But the main point being that in hindsight, looking at that year of therapy that was so hard for me, where I don't feel I had much growth, there were times where I'd leave therapy and my husband, my 2 kids would leave in one car and I was in the other car, because it seemed like every time we were in therapy, I wasn't allowed to speak as much. My ideas were always sort of rearranged. And there were times where I didn't want to live anymore. And it was the first time in my life that I'd ever felt suicidal. But I couldn't understand how I was trying and engaged in a process to help my family, and it was not creating any well-being. It was creating more doubt in me and more insecurities. And when I look at it in hindsight, and I now understand that all 3 adults in the room were only looking at me through the lens of that diagnosis that only they knew, because it had never been shared with me that this is what was thought of me, that it almost drove me insane. It almost drove me to not want to be it drove me to not want to be alive anymore. And what kept me alive was my love for my kids and how deeply I understand and care for them. And if I wasn't there, who would be that person for them? I hope that therapist never does that to anybody else again. I'm glad I found out that that is what happened, because otherwise I still might be wondering till this day what was wrong with me during that time that I couldn't understand anything. So yeah, don't do that to people, please.
There was also side conversations.
There were side conversations where the therapist would answer my husband's text if we were on the threads, and emails. But when I wrote, there was nothing ever being written back to me. And I would tell my husband, that's so weird. Look at our thread. She responds to all your messages and questions. And when I speak, there's no response. Why is that?
And maybe you could just like hit lightly on the parental alienation that occurred from that.
Well, in front of me and my husband, the therapist apologized to my son for him having such a difficult family. My husband was told that I would probably never get better unless I had really intense live-in therapy for months, if not years. And my children, from attending the therapy and seeing me being spoken to in this way by an expert, stopped believing that I was a capable mother, human, woman, wife. They just didn't believe in anything I said anymore. I would cook food. They weren't sure if it was healthy. They would look at food in the fridge. Is it still good? I keep a good fridge. Nothing I did was trusted anymore. And it was so hurtful to think. I lost hope for a while because I thought, how do I get out of this? How do I prove to people who loved me before that I'm still worthy of love? How do I prove that to them when their door to my love is closing? And once we started working with Dr. Swim, and she was able to bring confidence back and hope and belief in ourselves, I was told, and we executed plans of consequences for our kids, where we were told that because our kids were difficult, we had to have increasing consequence. So if they didn't learn the first time, it was an hour without the phone. If we asked the second time and they still didn't listen, it was an hour without the phone plus a 2-hour added. And they had a chart of consequences like that went from 1 to 6. And you met my husband before. He's more happy-go-lucky and less of a stickler for these uncomfortable situations. So I was the one unbeknownst to me, for a few months, I was the one who was the only one implementing these consequences. And at one point when it didn't work, the therapist just told my kids and my husband that I was no longer going to discipline or parent them, that this was going to be my husband's job. And I should just stay in the background and not interfere anymore. And it sounds crazy when I say it out loud, but when you're in the trenches and this is happening to you, and DCSF gets involved, and a psychiatrist, and a suicide, and removing aspirins, removing knives and ropes from the house, and you're just in this survival bubble, you can't see clearly what is happening. Only with hindsight can I look back and see how messed up this approach was. That therapist also insisted we install cameras in each one of our rooms in the house and in my car. And she told family members, not me, to send videos of me when they didn't like my behavior. So it got to the point where my kids would set up in front of one of the cameras situations to aggravate me and to create things that they knew they wanted to happen. They were triggering it to happen in front of the camera, so they would have something to send, so they could confirm to the therapist that their mom was really not capable. Thank God I have a strong psyche. I run a nonprofit. I care for people. I am involved in my community. I'm competing at World Games in 2 weeks. I'm juggling a lot of really positive aspects in my life. But I'm not a narcissist. I am not incapable. And I can probably guess that the therapist has some of those issues herself, because I was labeled as somebody that I am not. And I think that's what that experience gave me, the open-heartedness to see my son, who had also been labeled and diagnosed and treated, as a human who was just being labeled and treated.
One of the things that I noticed, like the first day that I met you, was that, you know, because I truly I don't see diagnoses, because I don't believe that. I think people have clusters of symptoms, but I don't believe in the idea of a diagnosis, or that a diagnosis can encapsulate the context of what's happening to somebody. I think it ignores the humanity of the person. And so, but I remember thinking to myself, how did things get so tough? Like, how did a parent lose the ability to parent? How did all of this kind of fracturing happen? I remember thinking to myself, you have a 12-year-old who thinks that he is going to be psychotic for the rest of his life. And just the pain and the suffering that you guys had been through was so prevalent. And how each person in your family was a lovely, wonderful, kind, intelligent, resourceful, special person. And how it was almost like you had these fake masks that had been assigned to you, where someone had not seen that. And I think, being an educator, I think that due to the high acuity of the problems, is that what happens with clinicians is that they stop seeing people as people and they see these problems and they must extinguish these in some ways. And so there has to be a villain or a group of villains, or somebody has to be more broken than the other person. And so out comes all the potential theoretic notions, you know, not just biological notions, but the theoretical notions. And soon you lose, that person's lost. And, you know, one of the things is that maybe you could just talk about, just briefly, the normalcy of your family now.
Oh, I found the video button.
Yay. Good to see you. Nice to see you.
Thanks. Nice to see you too. Well, the normalcy is they talk back sometimes, and they don't clean up after themselves, and they're just normal kids. And I deeply appreciate the really, really boring nights when we have many in a row. It used to be stuff was thrown and screams and many days a week when we were in therapy. And 2 weeks ago, my 15-year-old, who was the one most convinced that I was incapable human on earth, agreed to come on vacation with me for 2 weeks. Just him and I in a camper on Vancouver Island. That to me was success. I couldn't believe what I'm speaking about are things that happened a year ago. And the medication and Simon being in treatment wasn't up until August. So within the 6 months that we've been working with Dr. Swim, I had therapists who told me I wasn't allowed to be outside of my house during therapy, or I needed to record them and review their information after a session before we met again. With Dr. Swim, we can call her or text her when there's a moment of need in the heat of the moment. And I found that really, really, really useful, because that's how I was able to improve my parenting patterns and my reactions, was in saying, can I call you now? Something is going down and I'm struggling to handle it. And right there she was like some, I don't know, I think of her as like a godmother of the heart. But right there she would be available and she would be hearing with her heart, not hearing through her theory. And often she would say, well, who told you that? And I'd say a therapist. Can you repeat your question again?
Well, all I know is that, I think that, I hope this isn't the last time that you guys share your voices. And I think it is so profound, because who teaches us really to be in this field is the consumer of the services. Like, it's not the type of field that you have a broken bone and you can say, okay, well, I'm going to set that and things are going to be fine. And you just have people that have so many opinions, and they really aren't taught to trust you. They're taught to look at you as if you're like an alien.
Deficient human.
Mm-hmm.
I think there might be that in your field of work, where there's the therapist and then the patients are here because they come to see you for help because they feel low.
Mm-hmm. Mm-hmm.
But I think until you're able as a therapist to make the person believe in their own gifts
Mm-hmm.
and their own capacity to solve problems and follow their instincts, and even be aware of bias or prior programming or ideas I might have bought into that weren't
Mm-hmm.
that weren't helpful.
Mm-hmm.
I was told to never look through my son's phone, that was a breach of privacy, my 12-year-old. And would I like it be done to me? Well, of course I wouldn't like it be done to me. But I also wasn't a 12-year-old who had 2 suicide attempts.
Mm-hmm.
But
Mm-hmm.
being told that I was crossing a boundary, that this was wrong, made me believe that I couldn't trust my own instincts.
Mhm.
And I'm not looking at his phone anymore, but the first 3 months when he was weaning off of medication and having some choices and friendships that I wasn't really happy on, I did look through his phone and I found a few things I could intervene in and help out.
And I think for, it just made me think of different things, but we always try to see everybody. So that doesn't mean everybody all together. Like what I loved about our sessions is that we could catch them when people were in a car together, right? Because people were so tired of therapy. Like the last thing they wanted to do is talk to a therapist. And so you would have these, like Megan was in on a call and Margaret was in on a call and Ashley were in on the calls. And we had these rich conversations that were just happen chance. Like one of them was in a pharmacy, and I think Megan, you were in for that call. And it was just a delightful call with one of your sons. And see, we saw delightfulness. We saw that you guys were wonderful parents and that you were going through very difficult times and life and death situations. But there wasn't something that was amiss, that, there might have been things that we can all improve on as parents. But it wasn't that we came in and we saw this chaotic, um, unsolvable type of situation. And, you know, I, a couple of years ago, we started enlisting um, clients, previous clients, or sometimes, a lot of times people that at one point in time had services that they were so brilliant because they had went through these before. And when you hear that someone went through this and they're okay, you might not be totally convinced, but it's like, well, maybe. Like those maybes grow. And those maybes of maybe it's not me. Maybe I am a good parent, you know? Because when we're told we're a bad parent, it's one of the most devastating things that can happen to us because we love our children so much.
And I was asked to keep myself on mute as a parent.
I know.
So of course I assumed they must think something's wrong if they don't want me to parent anymore and they're expert.
Well, but what does that teach the children, that their parent cannot parent them? So it doesn't, nobody would have to even say anything. If that was my parent, I would interpret it that, oh my gosh, there's something wrong with my parent, that they can't handle me. So, like, what are they good for? Because we don't think our parents are good for too much when we're young, right? Like, you know, they're lazy because they don't do the whole house, that, you know what I mean? Like, that's how kids are, And so I think as therapists, we can make or break a family. The way we go in there, the way that we, like, even what your husband was talking about earlier, the way that we treat each person is being seen by everyone. And we can easily destroy families. Not only we can cause harm that might lead to really severe consequences. And when those severe consequences happen, then what clinicians say is that, well, that was part of the pathology. They have not been taught to look into themselves and to see what they might be doing. Because if anybody's not getting well, in my opinion, then I'm doing something wrong. It's not the person. And then how do I find out what to do right? I ask. Like, what am I doing that's not helpful? And help set me back on a course that is more helpful. Because we're team members. And when you said that therapists think they're here and the client's there, I would say therapists think they're here and the client's there.
Right, hairdressers kind of work more closely. The person fixing your car works a bit more closely at understanding the issue.
Mm-hmm.
But I understand that it's a sort of conundrum because in order to get paid for your work, you have to give a diagnosis.
Mm-hmm.
So the reinforcement to diagnose people is the first thing that occurs when I sit down, or anybody sits down with a therapist. The therapist has to find, and I found this out because there was one of our son's therapists who would meet with my husband and I for an hour after, without divulging what my son had shared, but would engage in conversations and ideas that were related. And at one point, he sent over a summary, and he diagnosed my husband with major depressive disorder. And I said, honey, did you see that? And Donald was like, well, I disagree. Why would he diagnose me? I didn't ask him. Most of us don't know that therapists need a diagnosis to get paid, and that they'll go off of that diagnosis to treat us. And most of us don't know that we have to ask to be privy to that information.
Well, the other thing is you don't know the consequences of the medications that are being given to you.
Or the diagnosis. What if DCSF had thought, well, there's this wife that this one therapist think is the worst mother on earth, and the father has major depressive disorder. There's more reason to think of them as incapable.
Yes.
I think anything that goes in somebody's medical file is really, really to be treaded on extra lightly.
So I'm wondering if maybe Christina, that you maybe have some ideas that you would like to add. You said you were going to add some ideas a little bit later, or perhaps Ashley, who and Megan, who were involved in this this
Family. This beautiful family.
I was gonna, because remember when I said you were, I don't know if you were here earlier, but I don't like the word patient. I don't like the word clients. Uh, people. I don't know if I don't know if we have the right word. Like, but the privilege of being with you guys.
And even trauma. Sometimes saying somebody has a lot of trauma is labeling them as carrying around this bag of pain and suffering everywhere. Well, don't we all have pain and suffering?
Absolutely.
I don't like the word trauma. I just, having spent time in therapy, I think it's easy to adopt the language of the system that didn't serve us. So I'm mindful about not saying we have trauma. We just went through a lot of shit.
Yeah, I love it. Maybe we can start doing with that one, right?
Yeah.
So,
but I'm happy to also answer anybody's questions if you have.
Absolutely. So I'd love for you just to put that on hold for a second. And so I think that maybe Christina, you could talk, and then we can get Margaret and Megan and Joanna and Ashley in on this conversation, and Jessica. Okay.
Carolyn, thank you so much for sharing your story. What you went through was horrific, and I can only imagine how it kind of was. Just so it was troubling to listen to, and then thinking about the repercussions of that. And I think even practitioners who don't lean anti-pathology, or who don't adopt this kind of non-medicalized approach to care, even most of them, the vast majority of them, I think, would find it horrific and unethical, the things that were done. Something that you said about with your work with Dr. Susan Swim, and that you're able to message outside of sessions or outside of meetings. I think that that's really wonderful and invaluable. And when I was sort of like in the system here in the Netherlands, when I was trying mostly to render services here, I was messaging clinicians, and then I was made to feel like I was being annoying, or that wasn't okay. And then I was kind of thinking, well, then why was I given their information, but I didn't realize that under insurance sponsored care, they also had, caseloads of 30 plus clients as well. And I'm sure if they were allowing that maybe everybody was messaging them or something. But I kind of, and as a practitioner, I sort of naturally just let that be an option to the people that come to me. And I find it's not abused, it's not used inappropriately. And I say this because this is the reservation that a lot of practitioners have against giving their phone number or their work phone number and allowing people to kind of message whenever. And I find that it's really invaluable and helpful to have it both as I guess as a service user and as a practitioner. I think it's been helpful. And so it's great to hear that from your perspective, that that's something that's helpful to you, because I believe it too.
And so, you know, one of the things is that you have a very unique perspective, because you do have a perspective of a clinician, and like a lot of us, you have other types of perspectives. So when you were listening to particularly this story, what were some of the things that were going through your mind that are things that need to stop?
Well, sort of secondary diagnosing, showing when Carolyn was describing that there was sort of this, I guess, secret pact that the clinician tried to form with her husband, and showing the this thing that I'm not even sure is considered a diagnosis. I don't know, but having a showing this to him, asking, does this, and sort of, I don't even know if this is yeah, it's sort of like a backwards means of doing that, just reading off things, reading off symptoms as if it's like, I don't know, as if it's a fortune or something like that, and then asking, does that fit you? It doesn't seem any it doesn't, yeah, it seems wrong on many levels. And then trying to keep it a secret, and then colluding, like getting her children in and saying, okay, well, you're going to, I mean, I'm not sure what was said, so I don't want to put words in anyone's mouth, but kind of encouraging this monitoring by encouraging cameras everywhere. And I think this is not okay. I don't know. I've never heard of anyone doing that before. I've never heard of a clinician, and it's surprising to hear someone who that really happened to. But I imagine that if it happened once, it's probably happened quite a lot. It's probably, and I don't know at what school or training institution or anywhere where that would be taught or encouraged or told that this is something that you should do. And I mean, as clinicians, as practitioners, we all go off script, right? Like we all divert a little bit from our training or whatever. We all have our own personal impression that we put on things, especially once we get to know a client really well. We might go a little bit with what we think will work well, or what or yeah, to kind of reach people in a way. But that just is totally, I couldn't fathom someone doing that with full conviction that it's helpful or that it's right. Or I mean, it's shocking to me that this person isn't afraid of their risking their credentials or their licensure if they have it.
So I'm just going to comment on that a little, is that I find where I live that there is this big cultural dynamic, whether it's psychiatrist, psychologist, or master's level therapist, that they know best. And so there's this overarching that because they know best, that it's a good standard of care, right? So they needed to do that in order to keep the family safe. Or they need to be like, I hear things that I just think to myself, like, where is the logic in this? And why would you have, see, I think I've mentioned this before, but as young therapists, when we used to hear of somebody getting a personality disorder diagnosis, it always meant that the therapist didn't like them. That whatever the therapist was doing, that was one of those diagnoses that, you know, like they are so bothersome, annoying, whatever, that they seem to get that diagnosis as well. And so I think a lot of times that therapists have a hard time seeing their role and the ethical process that it should be in, because they are not there to judge people. They are not there um, to change that person. They're there to assist that person in the way that that person wants to be assisted. They're not there to change their complete political, beliefs. They're not there to make, they're not a mini me. And I think that there's a lot of clinicians that feel that way, or whoever they see they're so hopeless about. So, but again, I think it has to do with the clinician's accountability of I was reading in the chat just a few minutes ago, and someone was talking about fear, and that certain things are done out of being afraid. And I do think that happens especially with mandated reporting. You know, in the schools, the mandated reporting is different than out of the schools. In the school, there's a zero tolerance policy. So if children are going to be too open with school counselors and things like that, there's going to be a huge amount of consequences, which is going to be different, I think, outside of the school setting. And new students are so afraid of not reporting that I think that they over-report. And I think that these types of things have to be looked into as well. I think there's just, I wish that we had so much more time to be able to talk about this. And I think the next time that we're going to create a lot more time. Because, in so many ways, what we're talking about is social justice and ethics on our behalf. It's our job to provide these ethical standards. And it's not the ethical standards of, what we've talked about before, the content ethics, the process ethics. What are the ethical standards with what we do with people that are relying on us and they're so vulnerable and they're in a position of so much distress that they lingered every word. The reason why I might say to people things like this is an intervention, because people who have been in therapy before, they're so used to I'm going to be saying intervention. So I'll be like, this isn't an intervention. It's a thought that I have, because I don't know what you should do right now. It's very complex and we can figure it out together, but to quickly say, I think you should do this or that, it could be very dangerous. So I was just wondering, like, if maybe just for a couple of minutes, and then I'd like to take this over just for a few minutes if we could, and answer some questions. But maybe, Margaret and Megan and Ashley and even Jessica, who's been working on some cases with us and is aware of how we were working, would you like to talk among yourselves? Like some of the things that you heard, and maybe some of the things that struck you that you feel are important in talking about the reflections of what this family was talking about.
Thank you, Caroline, for sharing all of that with us.
And Joanna as well. Sorry if I'm leaving anybody else. Sorry.
Yeah, what you went through was really, really, I can't imagine. I know it must have been so difficult. And my family was touched by the system as well. I won't go into all the details, not as profoundly, but
profoundly. But profoundly.
profoundly, yes. I mean, it affected me to the point where I went into this field because, you know, I wanted to figure it out myself. I wanted to figure out, you know, what are these things that these psychologists are talking about, and what are these interventions that they're doing, and what do these medications do, and, you know, why are they saying that my brother's brain is wired differently, you know? So yeah, I mean, I guess you could say that it did have a profound impact, just in a different way, Susan. But I guess what I wanted to say, and I said it in the chat too, is that I sincerely believe that people who go into this field do it because they genuinely want to help people. And there is so much, it's almost like the humanity is sterilized in a way, because of the clinical training, and all of the legal stuff that you have to learn, and all of the scary stuff that you're told, you know, can happen either to you or to your clients, you know, because of this or that wrong thing you might do. So it's almost like you're in this minefield. And honestly, I didn't have the tolerance for it, and I left the field for a while until Susan pulled me back in, because it is very difficult to navigate, because once you see the system for the injurious system that it is, it's very hard to figure out how to work within it, because you don't want to hurt people, you know. And I think I don't know if all practitioners see it. I don't think that they do. Otherwise, I don't think they would be doing it. But once they do, it's you have to figure out workarounds so that you don't hurt people, but you're also like within your training, and within working within the system, and that's very hard to navigate. So yeah, I've had so many thoughts, and I hope I wasn't too verbose in the chat, because I was just like saying stuff as I thought it, because I knew I would forget. So anyway,
Thank you.
I'm glad that your family is doing well now, and yeah, hopefully we can help more.
So then I'm just going to ask a couple questions between Megan and Ashley, if that would be okay. And so, how was it for you guys to participate in, and especially, you know, Ashley, because you shared stories of recovery. How was that for you to be able to share heroic stories?
Hi. So it kind of felt natural and second nature, because it felt almost as if I was talking, like I was looking into like a window of my past experiences and things that I had personally experienced throughout my lifetime, and was seeing it, but manifested in something that was totally different. Like no situation is the same, and I'm not trying to say like what I experienced is the same at all, but you know, I did have my own personal experiences with the system and how it really hurt me and my family. And so having the opportunity to chime in and be like, hey man, it's gonna be okay. I promise it'll be okay. You'll make it out the other side. It felt like I was tapping into like what I needed to hear at the time. And so being able to share those words of wisdom without having to go through an extra 10 years of being on those medications and like going through those cycles of withdrawal and you know, being put back on them, and without having, like, I felt like I was genuinely helping someone get out of the hardships that I experienced. So yeah, I'm just happy to help and happy to share my mind and what I've experienced. Like, I see myself as like the big sister. I do have a little sister as well. So if I can help anyone else in life not have to suffer the same way I have, I'm happy to do it. And that's why I'm here. And, you know, thank you for everyone who's donated their time today to listen to us talk. And, you know, a lot of the work that we do is completely donated. So, you know, I really am just grateful that we can help each other through the hardships of life, because it's normal to feel, it's normal to experience, it's normal to be emotional, it's normal to be 15 and, you know, maybe hyper and have a lot of energy, or, you know, all of these things are normal. And at what point, as in the field of psychology, did we disnormalize being human? At what point did we make it that it's a problem to be emotional? Because we are human, we are innately intertwined with our feelings. When we lose someone we love, we're supposed to feel distraught and stressed, and we're supposed to be completely emotional. It's a driving force in life. It's what makes babies. It's what brings the world the magic that it does. And it's, you know, at what point did we decide that we needed to sedate that, and we needed to stop being the feeling beings that we are? And, you know, the field of psychology, like, I feel like I've stepped into this work of like wanting to help people navigate these emotions, but needing to confront that the emotions are not the problem. The fact that we feel like we need to sedate them and bottle them up is the problem. And so I think it's very powerful then when we find ways to channel these emotions and channel our inner power, our inner wisdom. And also earlier in the conversation, we were talking about, I believe it was Rod that was saying that we need to go through the difficult times to become liberated from the prisons. And when we're in this state of sedation, then we're feeling very uncomfortable situations to be comfortable, but maybe that uncomfortability is there for a reason, so that we can create something else, so that we can do something else, so we as people are not stagnant. And you know, a lot of things in the world are very uncomfortable and really difficult to sit with. And I think that the fact that it is uncomfortable is a call to work on those things as people. And that kind of expands into a larger conversation. It gets into systematics, but that's not my role. My role here is to say that we're human, we all have emotions, and our emotions are here to tell us something and bring us our own empowerment. And that if you learn how to work with those emotions, and if you learn how to channel those emotions, then you can unlock your own superpowers, and you can learn how to navigate life in a way that works for you and your people. And it is not easy, and there's no systematic way of doing any of life, because life itself is not systematic. No tree is going to grow the same. No flower is going to be like the flower next to it. It's all going to be very different. And every person has their own journey, and we should respect that and honor that and let them have the reins on their life and just inspire them to keep going and help them.
Thank you. So I'm gonna just quickly move down to Monique, and Monique had I thought maybe you might have something that you might want to add to that with the wisdom that you have. Or I think you might be on mute. And did Monique have to leave, or is she still here? And it says, yeah, I don't know if Monique is still here, but
I'm still
oh,
here.
oh, I'm so sorry. I'm cutting you off. I'm fast, right? So is there anything within that resonated with you?
Yeah, it did. I think just hearing what Carolyn was saying about just like how to respond to certain like things that happen in your life with that notion of like feeling like if something was to happen in my life where, you know, it caused an emotion, whether it was like, you know, I'm nervous about something happen or something sad happens, that I think my natural response with having these diagnoses that I was given was like, oh, I'm feeling an emotion. That must be my anxiety. Oh, I'm sad because something happened. Oh, that's because I have depression. And I think just naturally feeling like those emotions fell into those bubbles per se, just not understanding that I'm feeling these certain emotions that are just natural emotions to feel when, you know, something I'm nervous about, something that's going to happen or something that is not good, like makes me sad, being able to process those without feeling, without through the diagnosis, without just feeling like, hey, these emotions are natural and it's okay to feel certain things that you're feeling, and how it has changed the way I responded to them. Where, you know, I think we discussed how a couple weeks ago I had, you know, a lot of family things going on with this person's diagnosed with cancer, and this was happening, and stress at work and all of that, where before overload would have been like, okay, now in my brain, my logical brain of thinking was like, okay, I have like 3 crazy things that are happening. Oh, that means this is time for my anxiety to kick in. And I think it was almost anticipating that when these situations would happen is, okay, now here comes anxiety, instead of just being present in that moment of whatever that situation was and knowing, okay, is there something that I can do to change the situation? Is it something that's out of my control? How can I feel this emotion without putting it into these names? And then just understanding that I'm able to, okay, that was stressful today. That was a crazy day today, but I got through it and I'm able to just move forward from it instead of feeling like I have to feel. I was always afraid to feel certain emotions because I feel like it was going to engulf me, whatever that crazy title was of what it was. So I think being able to understand that like things happen and being able to like work through things and talk through things and has changed how I respond to just life in general.
And that you have faith in yourself.
I do have faith. Exactly. I do have faith in myself and I trust myself more, where I start to feel the same way, where it's like, I didn't think I could trust myself and being like, oh no, when something happens, or it would be where I wouldn't even trust when things were going good, because things are going good for too long. There's something that's going to happen, and that's going to be like, hey, this has been too long that I haven't had anxiety or felt depressed or felt this. Like, this can't be going on for too long. And I think I almost anticipated the next time I was going to feel that symptom of whatever that diagnosis was. And now I trust myself of feeling like I can go through these things, and I trust myself of how I'm going to be able to respond to the things instead of like reacting to them, and being able to do that with knowing that, you know, it's perfectly normal to feel certain things without feeling like it's something that it's because I have a problem or I am this or that or whatever they were calling me at that point. So
It's such you know, and I think that we talk about this, that it's so simple. And so people a lot of times can't believe that it can be this simple, but it is that simple. Like, when you do not think that whatever mental health diagnosis that they said you had and kind of the trajectory of what's going to happen to you, you find freedom from that and your own self-agency that's been there all along and your own strengths flourish. But when you do not see that, it is a prison. And it is a prison that has little escape.
Yes, I agree. I think with my family member who also still kind of falls into that, my cousin, I think we've spoken about. I think she's coming around to trying to try different things, but I do think on her, I think she feels at this point that when she's going through these experiences, it's that little magic pill will make it all go away. And I think she's kind of been brainwashed to feel that way, that like if she doesn't, do these certain things, then it's going to trigger. And then I think it's her way of, she's feeling like this because I think what she says, it helps her understand why. Well, I'm feeling like this because I have this. But I was trying to explain to her, it's like, no, these things are going to happen. So these natural emotions that you have don't have to be classified as these diagnoses, is based off of how you're responding to life's events, or how you're responding to daily things, or those kind of situations where I think a lot of people do feel that if they don't have this like certain thing that's going to help cure how they're feeling, or which then she's going to continue to quote unquote be crazy. So I think it's just very interesting on how it's like what you said with my self-agency and being able to trust myself, that I'm able to go through different things and being able to communicate in an effective way with whatever circumstance I'm going through at that moment, or even giving myself grace, or that, it's okay to feel certain things and not have to feel like I'm losing my mind or I'm anything specifically called.
Right. Right. And so I was just wondering, because Jessica and I had kind of talked a little bit about maybe what you wanted to say, and you don't have to say anything, but is that still something that you would like to do, is to have just a little bit of a few moments to be able to share your wisdom?
Yeah, thank you so much for having me here and putting this on, Dr. Swim, for these important conversations to happen. And just wanted to thank Carolyn and Donald for sharing their story as well. I know it takes a lot of courage and a lot of remembering the hard past, but it's really felt and seen here. So yeah, I just wanted to thank you. And yeah, I met Dr. Swim. I don't even know how, but I was looking for like an equine assisted therapy placement because I am doing my counseling internship, and I came across Dr. Swim, and it's been such an amazing experience to see the work that she's doing. And I've had the honor and privilege to work with a few folks that are connected to her. And just to see families come back to their heart center and come back to love and acceptance and understanding of one another, and really having those conversations that are so valuable and important. And the way that Dr. Swim just like holds space is such a good example of what therapy should look like. And yeah, I guess through my own personal experience with the healthcare system, when I was a teenager, I went through a really hard time with substances. And so I ended up on antidepressants for about 4 years. And then I noticed that I was having more of a flat effect. And I recognized that although it was helping with the depression, it also was hindering my happiness. And from that point on, I think I tried about 4 other medications just to realize that all of them had side effects. And all of those, like most of those side effects, needed another medication. And at that point, I realized, and I had enough trust in myself to know that that wasn't what I wanted to move forward with. And so I worked really hard on healing what I needed to heal on an emotional level to move forward. And then fast forward a few other years later, I was going through another really hard time in my life, just being in an unhealthy relationship. I was going through my bachelor's of social work. I moved about 5 times that year, and just all the things that you could think about. And I went to a psychiatrist for ADHD diagnosis because I wanted to get better at school. And what happened was I ended up having a conversation with him about what was going on in my life. And I think I sat and talked to him for about 15 minutes. And he had mentioned to me that he sent me home with a prescription for bipolar medication. And then said to me, like, if this medication works, you have bipolar. And if it doesn't work, then you probably have borderline personality. And at that point, I think I threw out the prescription. And I knew I was going through like a really hard time. But my concern is just for those people, there's people out there who maybe don't feel supported or don't have as much trust or faith or belief in themselves, to be handed those prescriptions and to walk away with some strength and certainty, knowing that they're going to come out of that situation. And currently I'm working with Indigenous population as well. And if we look to our sisters and brothers in New Zealand, the Māori population, their culture is very much preserved and celebrated across the nation, and those they're able to stand strong together. And I think what I'm trying to get at is how valuable it is to be seen and celebrated and to be preserved in our wholeness and our essence as a soul on this earth. And my hope is that for our Indigenous here in Canada to be embraced the same way that New Zealand has embraced theirs. So yeah, I'm just really passionate about this work, and there's so much I could say on this topic. But thank you for listening, and thank you for all being here and having this in conversation.
Thank you. And, one of the things I was thinking, we just didn't plan enough time. It's very difficult to do that when, each time I think that we have these conferences, we learn so much more about how we might want to do this in a way that we can be heard too, Jessica. That, for me, the culture of people being told that there is no hope for them is very large at this point in time. And somehow, as we've talked before, a lot of people figure it out for themselves. Like maybe like we had someone on earlier that wasn't able to stay on, but when she started having heart problems because of the medications and she went off of them, then she found out that she had been imprisoned in this medical prison for a period of time because she felt that if she didn't take the medication that that she wouldn't be able to function at all. And because she had been told that. And so then once off the medication, her life began again. And I don't think people realize is that this is like almost mental castration in some ways. And it's not benign. It's so popular, but it's not benign. And when we don't diagnose, I mean, I do think there's a portion of us that have to diagnose for insurance companies. But when we don't diagnose, when we aren't when the lenses that we have to see each person is not through the lens of a diagnosis, it's not the lens of a particular theory, it's not the lens of what my father's political views were, it's not the lens of if there is a religion in my household or not. With, you know, we're not supposed to impart what we think is the good and right for people. That's not what they're coming for. They're coming for alleviation of the suffering that they're going through. And maybe Christina, you can talk in a couple of minutes. We're just going to run over a little bit longer, but I just wanted to read something that I had gotten from someone last night, and I had and something from somebody that was going to be here but decided differently not to be here, because to be here to be able to talk about these lived experiences is sometimes very not sometimes, I think it's very soul pinching. But the purpose of all of us being here is to stop this, to raise consciousness. It's a consciousness awareness venue. And so I just want to read a little bit of this. And it was just from someone that we worked with at one point in time. Some of you guys might have worked with this individual, but it said, you know, hi, I was a patient of yours years ago. Hopefully you remember me, but if not, that's fine too. I just wanted to send you a message thanking you for everything you did for me. I truly did not know where I would be or if I would even be alive without your help. Through your compassion and ability to empathize, you changed my life. I certainly would not have be the person I am today had I not met you. You were there for me when I wasn't there for myself. And for that, I will be eternally grateful. It's been a long journey, but I'm doing well. I am clean and working and happy and so much more. I would love to catch up. And the reason why for me this story is so poignant is that this was a person who came in and saw one of our clinicians in training, and that clinician in training was told that that this person was an addict and that they weren't supposed to be believed, and that doing talk therapy with them was basically inadequate, and that the only way that this person could get well was through the traditional recovery modalities. And and I that was after the first session. The first session she had with this person, she came back so happy, so elated, because she had this wonderful human to human conversation with someone that so desperately wanted to change. And then the intern came back in the second session just feeling so confused and almost ashamed that they had been as caring and transparent. And I think that that just talks about what accidentally happens in the training that we receive. So, Christina, would you like to talk about any of the reflections that you have with this? What's important for you to talk about? And I'm so sorry that I did not create a space where we could all have a lot of time, but I do think that the space that was created was extremely important. I do appreciate every single voice, and I wish that that well, I know the next time we're going to have a lot more time than we had today. But go ahead, Christina.
Yeah, it was difficult but inspiring hearing the speakers, and by that I mean hearing how they've kind of come out the other side of various situations, and sort of tying it back to the theme that Rod introduced earlier about faith and trust.
Activity.
Yeah, and listening to everyone, it's sort of like a perversion of that over time, is that people come to these systems with their complete trust and their faith that even if it's just by virtue of a lack of other options, or just trying to do the best for themselves and the best for their children. And it's really unfortunate, but I think that going forward, that's something that we need to just continually remind ourselves of. And that's something that you said earlier, Susan, is that we see people at their most vulnerable, at their most broken, at the most difficult times in their lives. And I'm not I don't think any of us went into this field thinking that we would have to look at people in such a systematic fashion, where there's so much there's too much management and there's not enough humanizing. And as we move into this more digital world, I think that sort of psychically our how it's affecting our brains, that also plays into our professions and maybe even our social relationships with people. So it's something to continuously be aware of and keep in mind. And I am really honored to get to know all of you and to listen to everyone. And I'm really hoping that that the tides are turning, and that we're that we're really changing direction collectively. I hope so.
Well, and I think with us, you know, at one point in time, someone said to me, well, this was a former consumer, that this is just a drop in the bucket, but a drop in the bucket adds to another drop in the bucket and another drop in the bucket. And I think that, I think that there is going to be a lot more options than there has been for the last 10 or 20 years. So, Megan, I don't know if there'd be something that you would also like to add to this. I really love to always hear your voice and Joanna's voice, and I didn't hear as much of it as I would have liked to. Is there anything that you guys would like to add to that?
I just wanted to say thank you. I have to head off. I have plans with my family this afternoon. My grandfather is turning 97, so
Oh my goodness.
taking my Baba over for cookies. Yeah, these conferences I think are so valuable. And Margaret, I appreciate you kind of like voicing your thoughts in the chat. I'm kind of same as you. Like, I've got a lot going on in my mind. Like, I took some notes. Yeah, there's just always, yeah, so much that comes forward. So yeah, I don't have too much more kind of like in depth to add at this point in time, but I am really grateful to be here, and for all of you being here, the courage and bravery to share stories and struggles, yeah, of life challenges and kind of different experiences with the system, and different perspectives. But yeah, leaving with hope and a lot of tidbits and pieces that I'm going to continue to think about, and integrate into like my personal life as well as my professional life. Yeah, just kind of trying to do the best that I can, right? And yeah, having like this community of other folks to connect with and talk about these ideas. Yeah, it's continues to be an important part of my life. So yeah, with that, yeah, I have to go.
Happy birthday.
Oh yeah, I'll tell Grandpa happy birthday.
Yes,
Love,
yes.
yeah, love and hugs to all of you.
Yes, yes.
Thanks so much for today.
Thank you. And who, can I just ask you who did the recording?
Joanna's got it. Yeah,
Okay,
and I
great.
assigned host over to Joanna. So
Okay, wonderful.
we're
Thank
all
you.
set.
Thank you.
Okay. Okay. Bye.
Bye. And Joanna, what were your like ending thoughts that you would? I had such an inspiration, just to let you know, I had such an inspirational conversation yesterday. Um, and it just started me thinking about like this solidarity, and how do we provide solidarity in so many different ways for people that maybe do not have it.
Yeah, I think it was inspiring just to hear the voices of perseverance and I really hope that more practitioners can see this lens that we're talking about. So that's kind of my takeaway from it. Ariel, you had mentioned some good comments over there. Did you want to add anything before we start signing off here?
Who?
Ariel, the lady.
Oh, wonderful. Would you like to represent
Wait.
that or?
You're on mute.
Yeah.
Oh, I can unmute her. Oh, I asked to unmute. How do I unmute? I mean, I think you were mentioning that you're a nurse practitioner and you've seen some of these things that we were talking about. So I thought that was a fresh perspective, which was nice.
Can you hear me?
Yes.
Yes.
Oh, okay. So Susan, I'm probably as old as you are. I've been practicing for a long time. And I don't know, I've seen, I don't know how I got on this panel. I'm sorry, I'm not very good with the computer. So I'm all of a sudden I'm seeing my face with you guys. Anyhow, so not only practicing, but I have interculturally lectured all around country, including Saudi Arabia. And it's really saddening, like Susan, you said, to see how the psychiatry is evolving or deteriorating. Because when I started lecturing countries like New Zealand and Australia and some of the European countries, they're a whole lot more humanistic approach.
Mm-hmm.
And as I start lecturing, I stopped lecturing, by the way, and they're asking more questions about medications because I prescribe medications. And it was a very saddening experience. And also, since I graduated so long ago, I didn't know, at least the school I went to, I have a psychology degree as well. So my probably approach is a little different from typical nurse practitioner.
Mm-hmm.
And nurse practitioner, at least the school I graduated, stopped teaching therapy since year 2010.
Wow.
Because the demand currently by, I don't know who, insurance companies or whatever, so has changed. So now, I mean, I'm volunteering at free clinic, right?
Right.
When I started volunteering, it was like they saw me as a prescription pad. And so I said, absolutely not. I'm not doing it. I may be a nurse practitioner, but that's not how I practice.
Right.
And I've been getting a lot of job offers. I mean, several a day, but they're all wanting us to be a prescription pad, essentially, because that's how your insurance gets involved.
Mm-hmm.
And one more thing I would like to add is, when I was very young, I traveled to Amazon with a group of people, maybe 12 from different countries.
Mm-hmm.
I got very ill, and the area we were in was a heavy jungle. So they couldn't ship me out. There's a boat or a barge or something coming in, like twice a year, twice a week. And the school I went was like a first grade to sixth grade. They're all in the same class. And then teacher comes from somewhere by the boat. So medical help was not available. It was a complete poverty. And so I was getting sicker and sicker. So they ended up having to take me to shaman.
Wow.
Because I was delirious by then. Because I'm not used to jungle.
Right.
And so I ended up taken to the shaman. By then, all I remembered was this shaman had a shaman, and then there's a female assistant or disciple, and then male disciple. And shaman looked at me, and they talked, and then this male disciple came with this pipe and started blowing some kind of smoke. And then at the same time, the female disciple, I mean, she had hair, black hair down to her ankle, probably never cut hair. And the most clear and beautiful voice she was singing throughout. I don't know how long I was there because I was so quite delirious. And then shaman came over. If there are like, I don't know, about 20 vials of some kind of herbs. And last thing I remember was I kind of was getting away by then. And then he kind of let me smell that whatever that was. And I'm not quite sure how I got better, but I was gradually getting better. And that kind of shifted my mindset.
Mm-hmm.
There are other ways in other society,
Mm-hmm.
and our kids have too much. Personally, our kids have too much of everything. And the kids I saw, the only pet they had was an anteater. I don't know if anybody knows the anteater. Pretty ugly, kind of religious looking thing. And they were so happy. No one wore glasses, no bad teeth. They have absolutely nothing. I mean, school opens twice a week, and then everybody is living in a hut, eating whatever is available. So, yes, that's fascinating. So other cultures, I think one more thing I would like to add is that there are other cultures that have the social support.
Yes.
It's quite different from us.
Yes.
And especially with currently with the digital era, there are a lot of social isolation. I mean, I've seen in my practice that is the probably crux of the problem, and that cannot be fixed with medications. Just like a lot of people said. Absolutely. Well, how can you fix social isolation with pills? I mean, I'm supposed to prescribe pills, and I don't. And
Congratulations. Congratulations. Because it takes a lot of courage to do something different. And, that's what I'm hoping that we become, is a sense of community for people.
yes,
Because it takes courage for me. I always say that I didn't want to do things differently than what the mainstream was doing. I don't, like I'm a people pleaser, like it's not easy to do this, but when we know differently,
yes,
we cannot do what we might have used to have done.
yes,
And not only in the jungle, but if you think about it, in different countries,
mhm,
you cannot get the ADHD medication because they do consider it speed.
yes,
You can't get Prozac or Paxil. They consider that a drug. And so, maybe the antipsychotics, but, because those have been around for a long period of time, and they think that somehow putting people to sedate people is going to make them happier. I was talking with somebody about that last night, that their child had been experienced one child was experiencing some symptoms and was doing fine, another child wasn't. But this child is isolated, lonely, in despair, miserable, each day is like a groundhog day of misery. And so a pill's not going to do it. Guess what? Therapy's not going to do it. We need solidarity. We need support. We need, you know, what we learned a long time ago. We learned this really. I really learned this in probably when we opened up this nonprofit in 2007. Is that people need a team. And that's why we work voluntarily together. So like no one's getting paid, but we work as a team. and and we do work. If someone needs to call us at 4:55 in the morning, then they call at 4:55 in the morning. Hopefully someone will wake up, right? But if not, we encourage our clients like to call back, right? Because who knows? But you have a team. When you have a team, you can get through things. It's not, it helps. It's not so heavy. There is infusion of hope. There's, we, and families used to be that way. We used to have aunts and uncles and more brothers and sisters and maybe we knew people in our whole small town or something like that, and we could, like today my bathroom flooded, right? And I did think, well, what if I have to go to the bathroom, right? Where am I going to go? Like I'd have to go to the nearest, convenience store or gas station because I don't know my neighbors. I can't knock on a door and say, hey, I've got, and so we live in such isolation. A pill cannot like help you with a broken heart,
Yeah,
Yes.
absolutely.
Or when we are so desperate in life. That's what we used to do. I was around, I don't know if you were around too, when we were doing ETC for,
ECT.
yeah,
Yes.
for women that were in marriages and so on paper it looked good, right? Their husband had a job and they had like 2.5 children and made a certain amount of money. Why in the world could these women be unhappy? And why were they symptomatic? And not being understood only drives those symptoms, because not being understood will make you crazy. And so I'm so happy that you had that experience, that you have the experience today to be able to talk about it. And maybe you would want to share some more experiences with us. I'd like to talk again. Like we don't have to have a real conference, but we could follow this up with some things that we feel important or to talk about.
Yeah.
And I want there to be solidarity among us, because when I first moved here from Texas, where I was part of an institute there, I was there all my adult life, and then I moved to California and like I have no colleagues,
Yeah.
like no one believes the same way I do. And it was very, very isolating. I used to travel to different countries, and teach there because nobody understood these ideas. And it's such a power position that people are in. They want to tell people what to do.
Mhm.
That woman that was singing to you, it came from her heart.
Mhm. Yeah, yeah, absolutely.
People's hearts healed you.
Yeah, it's a healing.
Mhm.
So when I practiced, I used the music therapy. Oh,
Mhm.
maybe you've done Century, Susan. I remember back when we did Century.
Yes, yes.
So one
Mhm.
of the venues in Australia I taught was, I asked specifically, I want to do it Adelaide, but it has to be by the ocean where the beach is available.
Mhm.
So it was very moving. So first morning session was more or less psychopharmacology because they wanted to hear about the drugs. And then in the afternoon, I sent out the people in a group. So they did this, it's, natural century. So they did the century and then came back. So I said, whoever would like to write poems, please do.
Mhm.
And so they were all looking at each other. Some are rolling their eyes, and then they start writing a poem. And I said, it doesn't have to be poem. It could be journal or paragraph or whatever that's in your heart. So they wrote, and I said, is there anybody who would like to share? I mean, it's not mandatory. And one woman got up. I just gets me tearful. She started to read her journal. And I can't remember, it was a while back. I can't remember what exactly it was. It was about her trauma, why she became a therapist, and how she healed. And so when she started to cry towards the end. So I started to cry towards the end, and everybody started, and then all got up, standing ovation.
Right.
That's what how we ended our session. And that was, I think, if I recall, I did a lot of lectures in different countries. Most gratifying experience I have ever had. And
Well, because we all deserve standing ovations. Life is very, very, very difficult. And I think especially when people find out that they have not been a mental illness diagnosis and that they're able to overcome this, that everybody deserves a standing ovation because not everybody applauds them,
yeah,
right?
yeah. Not everybody applauds us either.
Well, that's true.
They think we're probably crazy, or I don't know, Flintstone or something.
Yes,
Yeah.
absolutely.
So congratulations for all of you.
So,
This is my first meeting.
to all of us
Yeah.
for
Thank
being
you
here
so much.
together.
Oh, thank you so much.
Thank you so much. So my friends, my friends.
Yes.
So
Could I
just,
share?
pardon me?
Sorry, could I share just
Yes.
my own final thought, just real quick?
Yes.
I know I sounded probably jaded with the system, and I totally am, but I'm not jaded with the people who work within it. And I think there's so much hope because just with this group of kindred spirits here, there were a few of us here, and I know that there are more. And I don't think we're going to be swimming upstream for much longer. I really think that things are changing and people are waking up. And when you hear psychologists and psychiatrists with large platforms, decrying diagnosing children with ADHD, you know that there's a big shift happening. So I have tons of hope, and I'm really inspired by all the stories that I heard today. And I thank everybody for sharing them. So anyway, I just wanted to I wanted to make up for sounding kind of jaded earlier, that, because I do actually have a lot of optimism too, and I think we all do. So anyway, thank you all.
I don't think you was hated. I really don't.
I didn't see that either. But
Yeah.
let's take ourselves off mute and applaud what happened today and what's going to happen the next time we meet. Thank you so much for all of us meeting together. It was wonderful to see everybody, and we appreciate the stories. We appreciate the transparency, and we hope that we get another chance to be able to do this soon. Thank you so much.
My gratitude to everybody.
Oh, guys, I'm going to take us off record for a second. Can you take us off record?